p.m. Eastern Time, feeling really good. Don't be afraid of COVID, the president writes. Don't let it dominate your life. We have developed under the Trump administration some really great drugs and knowledge. I feel better than I did 20 years ago. This comes as we expect a medical briefing from the president's doctors anytime now. About 10 to 15 minutes from now is what they've told us for our guidance. Let me go to Peter Alexander, who is on site at Walter Reed Medical Center. Peter, we had heard that perhaps the president would be discharged today. Now it appears from his tweet that he will be.
Yeah, that's exactly right. And what's notable is that this announcement came from, I guess, what you would call the patient in chief and not from his doctors. The announcement coming from the president by Twitter even before his doctors had an opportunity to brief reporters on the state of his condition. And of course, there's been a lot of contradictions and confusion about his health over the course of the last 24 to 48 hours. So when he departs this evening at 6:30, his total stay at Walter Reed will have been less than a total of 3 days. But in conversations I've had with those close to the president, they say that he has communicated that he is, quote, ready to get out of there. The president has been itching to depart for at least the last couple of days. He says he's been feeling well, but one of the questions has fundamentally been exactly how well he is, given the fact that among those drugs that he's taking right now, a steroid called dexamethasone. That is a steroid that's typically given to severely ill coronavirus patients. Behind us right here, you can see a crowd has gathered, more than 50 Trump supporters, many of them yelling and screaming as cars pass by, honking in support, trying to demonstrate their support for the president. The president yesterday had been pushing to go home, but settled for that little impromptu drive-by that we saw. Today it appears that he will be departing for good from Walter Reed. The question now remains, if there's a setback, will he be forced to return? I'm told it's been communicated to the president that the bad optics of a setback would be particularly bad for him now less than a month from the election. Kate?
Peter, stand by if you will. I want to also go to our chief White House correspondent, Hallie Jackson, who is over at the White House. Hallie, Peter mentioned that drive-by last night. There's been a lot of criticism of that. Yeah. But tell us what's happening at the White House now in anticipation of the president returning. Where will he be within the White House complex?
Presumably in the residence, Kate. Remember, this is a president who has an active, contagious, infectious virus as we speak. And so CDC guidelines indicate that anybody who is tested positive for COVID needs to isolate. If you have symptoms, it means you've got to isolate for at least 10 days and then be 24 hours fever-free. So presumably the president will be isolating at the residence. That is where he had been prior to departing for the hospital early Friday morning, when we know that he was getting sicker faster, according to what his doctors were saying, spiking that fever and having that rapid drop in blood oxygen levels. The First Lady has been at the residence. You mentioned the drive-by, Kate. Interestingly, she had not planned to visit her husband at the hospital, according to her office and sources close to her, because she didn't want to put people at risk by getting into a car and driving to Walter Reed. So presumably the president will be here at the residence, and he will be isolating for a period of time. One of the things that I'm interested in finding out from Dr. Sean Conley in just a couple of minutes, the president's physician, is will they follow those CDC guidelines and have the president isolate for that full 10 days? He is a patient, but he is also, Kate, impatient. He wants to be out and about. This is less than a month to the election. For months, I've heard from sources that this is a president who wants to get on the road and see people. Obviously, his diagnosis makes that absolutely impossible in any kind of responsible or safe way. But Kate, when you ask what it's like at the White House, I got to tell you, it's really quiet. That's not just because the president is not here. It's also because we now have additional White House staffers who have tested positive for COVID. That includes White House Press Secretary Kayleigh McEnany. We learned today that she has tested positive after a series of negative tests. And that's really critical here because, as our medical experts keep saying, those tests are just a snapshot in time, right? That test tells you how you're doing at that moment. The virus can still develop, the viral load, and mean you can test positive later on. It appears that happened with McEnany. 2 of her deputies, 2 other White House staffers here, have also tested positive, we've learned, just in the last few hours. So you can imagine it's pretty dark in there, Kate, at least for the areas that reporters are able to access. Most staffers are working from home. They are not coming in. Some are. And when asked why they're not home quarantining, the argument is, well, they are classified as essential workers. So the things that they can't do at home and need to come into the office to do, that is what they are doing here. But it is certainly an extraordinary situation, Kate, that you have the president now returning to the White House we also know, and we should be clear here, he is getting treatments, right? You talked about the therapeutics that he's on. Peter referenced some of the drugs he's getting. One of them, remdesivir, is an IV administered drug. Now, the White House does have a full medical unit. That is what officials keep talking about, that the president will still have a very high standard level of care here at the White House. It's not like if you or I to go back home out of the hospital, right? And it's just me and you hanging out with our families. The president will have a team of people here in order to help him through what is still days potentially of recovery left to go. That said, there was a reason he was moved to the hospital in the first place. And one of the questions here is about the credibility of information that we have been getting about the president's condition. The president's doctor just this weekend had to essentially acknowledge that he painted a rosier picture initially about the president's health than was actually the case. Conley was pressed on that yesterday, and it's possible, Kate, as we take a look at the microphone where he is about to come out and speak, that may happen again today. A lot of questions still to be answered, including about the president's condition, Kate.
Thank you, Hallie. Let me have you stand by also, and let me go to our senior medical correspondent, Dr. John Torres, because a lot to talk about here. Dr. John, pick up where Hallie left off. There is a suite inside the White House with medical personnel. It is possible to have, treatments happen there. However, I know you've said this is unusual, even for a VIP patient, to go home when still taking remdesivir, for example.
Exactly, Kate. It's unusual for them to go home when taking these medicines. Plus, if you remember, 7 to 10 days, that's the time period after symptoms start when we look at the patient, because that's the most critical time period for when they could start having symptoms worsen, they could start getting in critical issues. That 7 to 10 day time period is going to start later on in this week. And what you don't want to have is have them outside the hospital environment, and then you have to try and get them back inside the hospital environment. And it's possible. Patients have had this happen with COVID-19, where they go from doing okay to not doing so well to all of a sudden needing to be on a ventilator in a very quick, short period of time. But the other thing you have to remember is the White House is not your house or my house. If we were sent home, we'd pretty much be on our own. We'd have to have family help us to take care of us. But at the White House, he's going to have a full staff. He's going to have full medical contingent. My guess is there are going to be doctors sleeping on cots at the White House, trying to make sure that he stays okay, watching him 24/7, constant monitoring. But that having been said, if they do have to do something at the White House, as in intubate him, put him on a ventilator, and then get him to Walter Reed, that is a difficult thing to do in any circumstance and not something you really want to have to do. And so him being at the hospital full time period, get through that 10-day period is extremely, extremely important. Another one, they keep bringing up isolation. Can he isolate at the White House? Because he still has to do that for at least 10 days after symptoms start. We're only 3 or 4 days into this, so he still has a long ways to go in that context. So again, even though he has the care there are some things we need to be very concerned about.
Let me quickly, thank you, Dr. John. Let me quickly go to NBC News medical contributor, Dr. Kavita Patel, who's also with us. And I know you've been talking a lot today about dexamethasone, which is the drug we just learned about yesterday that the president has been taking, a steroid. You've talked about side effects of that. What does that look like moving forward?
Yeah, critical here is that dexamethasone, a commonly used steroid, but not in the doses that we're seeing, has been studied. But again, in people who are either oxygen dependent or require ventilation or at a further illness in their COVID-19 disease than what we've heard from the president's doctors to date. Side effects are incredibly numerous, with some of the most concerning ones being a spike in blood sugars that can mimic diabetes, depression, psychoses, and really just all around a suppression of other parts of the body's normal functions. It is not a drug to be used lightly, and it is something that, again, to Dr. Torres's point, is along with other drugs the president is on, requires close monitoring. I've worked in the White House and I've seen what the capacity is for the White House medical unit. They can do a great number of things, but it is not a substitute for intensive care unit level of care or hospital level of care.
Okay, thank you so much for that perspective. I want to go back to Hallie Jackson, if I can, just before we go away for a bit here, Hallie. Talk to me about the optics of this and the politics of all of this, because we are so close to an election. The president clearly yesterday wanted to show himself, wanted to be on video, and then went on in that motorcade to greet people through a window. What are the optics today about returning home at this point?
Well, it's a message from the president, Kate, that he is still in charge, in command, and able to lead the American people. That is the message that he and the White House want to send. And in fact, it's a message they've been trying to send even from that very first moment Friday, 72 hours or so ago, when the president first stepped onto that helicopter from the White House to go to Walter Reed. There was a reason why cameras had been positioned to be able to see the president walking under his own steam onto the helicopter to be able to go to the hospital. That is what we are seeing now to another degree, right? The president's drive-by, the video that we've been showing, that was another example of that. He wanted to get out and talk to his supporters. He also, I think, Kate, wanted to get in front of the cameras. He tweeted even just today that he felt like, hey, if he didn't do that, the media would say it was rude, and if he did, the media would complain. So he felt like he was in a no-win situation here. The bottom line, this is a president who wants to be out and be seen by people. That is something that has been consistent over the last, frankly, 4 years that I've been covering him. So it should not be surprising that even hospitalized, even dealing with this infection and with this virus, he would still want to do the same thing. I will say, Kate, when you look at sort of the optics at play here, the thing that we'll be watching for is, and there are a lot of people around this country, I think everybody hoping that the president does get well and get well soon. If something were to happen, as Dr. Torres is talking about, that sometimes with these infections, something can sneak up maybe on day 5, 6, 7, and the president were to have to return to the hospital, that would be, I think, significant. And the White House would have to be able to answer questions at that point about why they moved him out of that setting just to take him back. Now, that's getting ahead of ourselves here. The hope is that the president will be able to remain here at the White House, Kate.
Right. And his supporters certainly hoping for that. There's even been talk about him attending the next presidential debate, which is a week from Thursday. Again, the headline today, the president saying that he will be leaving the hospital at 6:30 this evening. We will return to Walter Reed Medical Center for a planned briefing just as soon as it starts. This has been a special report. I'm Kate Snow. Good afternoon. We're back on the air because the president's doctors at Walter Reed Medical Center are briefing about the president's condition. Let's listen in.
The president has continued to improve. He's met or exceeded all standard hospital discharge criteria. He'll receive another dose of remdesivir here today, and then we plan to get him home. It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturations and his work of breathing, are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care 24/7. I'd like to bring Dr. Dooley up to review some more specifics.
Good afternoon. Just a brief update this morning. As Dr. Connolly mentioned, the president continues to do very well. His vital signs this morning were notable for a temperature of 98.1. His blood pressure was 134/78. A respiratory rate of 17 respirations per minute. His heart rate was 68 beats per minute. And his last oxyhemoglobin saturation was 97% on room air. He currently does not endorse any respiratory complaints. And aside from our evaluation with the multidisciplinary team this morning, has maintained a full schedule, ambulating and working on the White House medical unit. I'll now turn it over to Dr. Garibaldi to again discuss therapeutics. Thanks.
Hi, good afternoon. And again, I just wanted to echo the sentiment of what an honor it is to be part of this wonderful team here at Walter Reed. Yesterday evening, the president received his third dose of remdesivir. He tolerated that infusion without difficulty, and his kidney and liver function continued to be normal. Our plan is to give the fourth dose of remdesivir this evening before he goes back to the White House, and we've made arrangements to deliver the fifth and final dose of his treatment course at the White House tomorrow evening. He continues on dexamethasone, and again, the plan for today is to continue to be up and out of bed, eat and drink, and work as he is able. And I'd like to turn it over to Dr. Jason Blaylock, who's an infectious disease specialist and the chief of medicine here at Walter Reed, to give some updates on infection control. Thank you.
Good afternoon, everyone. First of all, I just want to say what an honor it's been to be part of this medical team behind me and to care for the president. Since the president's arrival at Walter Reed, he's received medical management that remains in line with national clinical societal guidelines for treatment of COVID-19 infection. In addition, both myself and Dr. Wes Campbell have worked very closely with various laboratories in the area, state-of-the-art facilities to include USAMRIID and RARE on obtaining advanced diagnostic testing to really inform the White House medical team of both the status of the president as well as his ability to transmit virus to others. Also, we have worked very closely with the Walter Reed team to ensure that we are looking very closely at infection control prevention strategies and the right posture so that the president can safely return to his residence. And with that, I'm going to turn it over to Dr. Conley, who will answer any final questions.
Thanks, Jason. I mentioned it Saturday, but I'd like to reiterate myself just how grateful the president and I are to the men and women of Walter Reed, our colleagues at Johns Hopkins, as well as the many federal, private institutions that we've received support from. And so long as everything continues on the track that we're experiencing right now, this time, as the president already tweeted out, is to get him home later today. With that, I'll take a couple questions.
Discharged back to the White House when he was given steroids. You've said that he's still on those steroids. Those are medicines, as you know, that are usually given to COVID patients who are on ventilators or with low oxygen. So did you over-treat him? And if he's still on that medication, how is it safe for him to return to the White House?
So we send patients home with medications all the time. In fact, yesterday afternoon, he probably met most of his discharge requirements safely from the hospital. And he's returning to a facility, the White House Medical Unit, that's staffed 24/7, top-notch physicians, nurses, PAs, logisticians, and the unit here, the team here behind me is going to continue to support us in that nature. Yes?
What infection control measures are you taking? And how was it safe for him to drive around in a cloth mask yesterday? And how is it safe for him now to return to the White House where there have been so many cases? How is any of this safe?
So the president has been surrounded by medical and security staff for days wearing full PPE. And yesterday, the U.S. Secret Service agents were in that same level of PPE for a very short period of time. We've worked with our infectious disease experts to make some recommendations for how to keep everything safe down at the White House for the president and those around him. We're looking at where he's going to be able to carry out his duties, office space, and I'll just say that it's in line with everything we've been doing upstairs for the last several days.
Can you tell us, please, on testing, can you tell us when he had his last negative test? Was it Thursday? Was it Wednesday? Do you remember when he had his last negative test?
I don't want to go backwards.
Contact tracing for people who are around him to know.
I understand. The contact tracing, as I understand it, is being done. I'm not involved in that. So.
Why did you begin the starvation that you leave, or was this something he pushed for?
No. So we try to get patients home and out of the hospital as quickly as is safe and reasonable. Every day a patient stays in the hospital unnecessarily is a risk to themselves. And right now there's nothing that's being done upstairs here that we can't safely conduct down home.
You said that 7 to 10 days was a window that you'd be concerned about. I don't think we're there yet. So do you have concerns about potential worsening or reversal, and what are your plans for addressing that if it were to happen?
You're absolutely right. And that's why we all remain cautiously optimistic and on guard because we're in a bit of uncharted territory when it comes to a patient that received the therapies he has so early in the course. So we're looking to this weekend. If we can get through to Monday with him remaining the same or improving, better yet, then we will all take that final deep sigh relief. But as I said, 24/7 world-class medical care surrounding him down there. We're not going to miss anything that we would have caught up here.
Physically going to be in the White House, and what does that look like? How do you keep him safely quarantined?
I wish I could go into that more, but I just can't.
Doctor, when did you begin dexamethasone treatment?
So that has something to do. Yesterday we talked about that, the several little temporary drops in his oxygen, and we had discussed that as a team and elected to start it early in case that persisted or worsened. The potential risks and side effects we all discussed. We looked at the data and decided that we'd rather, push ahead on it than hold and risk, the opposite.
And what about CT scans and chest X-rays? What have you seen on his campaigning?
As far as travel goes, we'll see.
Mental status, can you talk to about whether he has any neurological symptoms? Does he have any side effects from his medications, any fogginess from the virus?
No, I think you've seen the videos and now the tweets, and you'll see him shortly. He's back. Yeah.
Pneumonia or any inflammation in his lungs at all?
So we've done routine standard imaging. I'm just not at liberty to discuss.
Doctor,
So you're actively not telling us what those lung scans showed, just to be clear.
So there are HIPAA rules and regulations that restrict me in sharing certain things for his safety and his own health and reasons.
Share how many times, you said his oxygen dropped several times. Can you share how many times he was on oxygen? You said you checked with the nursing staff yesterday?
Yes. So he the 2 episodes like we talked about yesterday, and both times that he received a little bit of oxygen and recovered immediately.
Was that oxygen required?
No, it wasn't required. He wasn't short of breath. He wasn't looking ill. It was more of us trying to anticipate needs and see how he'd respond. And in both cases, it came right off. He didn't need it for very long at all.
You were on board Air Force One for multiple trips. Are you at all concerned about your own exposure and exposure to the medical team?
I am concerned, but as the CDC says, there are caveats for essential employees. That as long as you continue to test negative, you remain symptom-free, and you keep a mask on when you're out and about, which we do inside the hospital 24/7, then you can carry on your duties. Yeah.
The
President's an impatient man. Has he been itchy to get out of here?
The president has been a phenomenal patient during his stay here, and he's been working hand in glove with us and the team. And today got to the point he's holding court with those of us around him, the whole team, going over all the specifics, the testing, what the future is, and we have been back and forth on what's safe and what's reasonable, and he has never once pushed us to do anything that was beyond safe and reasonable practice that we all first wanted.
Medical team who recommended against the president leaving here and going back to the White House today.
Or
any White House staffers?
No.
The president said don't be afraid of COVID. Do you agree with that? Should we not be afraid?
I'm not going to get into what the president says.
His heart, liver, and kidney function was normal or improving. Improving, does that mean that there were effects, and is it all normal? Like, what's up with that?
Yeah, it's all normal right now. I would say he appeared to be a little dehydrated Friday. He was able to just drink and recover from that, and yeah, everything looks great.
Campaigning out in the country, what sort of things do you?
Yeah, so the big first thing that we need to do is that there is no evidence of live virus still present that he could possibly transmit to others. And that's what the infectious disease experts and some of our partners, military civilian entities, doing some of these advanced diagnostics just to see as soon as we can identify that. Routinely, we talk about a 10-day window, CDC guidelines, but we're checking him more routinely than just waiting 10 days. There's a possibility it's earlier than that. There's a chance that it's a little bit later, but we will know as soon as possible. And then we will look at him clinically. How are you feeling? How are you doing?
Why have you decided not to administer hydroxychloroquine to the president during his time here?
I'm not going to go into all of our debates about specific medicines and therapies. There are dozens of therapies that we were made aware of, that we considered, that we discussed and debated and looked at, the existing literature on. And this is the regimen we chose.
Hydroxychloroquine.
In terms of COVID, is he having some of the muscle aches? Has he lost his sense of taste and smell?
No, we were just talking about that, what symptoms he has left. And he's even the slight cough that he used to have, he doesn't really complain of at all. He hasn't ever complained of muscle aches. Yeah, he's up and back to his old self predominantly.
Next Monday, just to be clear, how long will he still be actively shedding the virus?
So this morning, I believe there was even an accounting by Dr. Fauci referencing the first 5 days of illness that people are most likely to shed live virus. There's a reason there's the 10 days is because most people by that time, after 7 days, most folks don't have culturable live virus. They put it to 10 just to give some extra space. It's never 100%, between everybody. So we'll see. I'm not going to put a specific number, but we look at that window is all I say.
Will the president be confined to his residence, or will he be allowed to return to the Oval Office?
We're going to do whatever it takes for the president to safely conduct business wherever it is he needs to do within the residence and White House.
And is he on blood thinners? And also, has he been using? Have you been giving him Tylenol, Advil, anything?
Oh, that
to bring
came
his
up.
fever
I
down?
would like to say he has not been on any fever-reducing medications for over 72 hours. Yeah, he's on a routine regimen of COVID therapy. I'm not going to go into specifics as to what he is and is not on, but.
This here that the president had a mild cough, some nasal congestion, and fatigue on Thursday. Now, back to my colleague Jen Jacobs' questionnaire. The reason knowing when the president's last negative test is important. For that reason, your words, what you said, and also for the contact tracing. But would you recommend it that, given those symptoms, that the president go to that Bedminster fundraiser?
It's not up to me necessarily, the president's schedule, but I would say that it wasn't until after he returned that we really sat down, then knowing the news of the day, that we really dove into how are you feeling, what's going on.
those were the symptoms he was experiencing on Thursday?
I'm not going to get into, operations.
When was his last negative test, and what was his viral load?
I know everyone wants that. Yeah, I don't have his viral load. Those are some of the diagnostics that we're sending out that will really tell us when it's safe for him to get back out and around people.
The last negative test was?
Any abnormal tests? Were any of his lab tests abnormal?
I'm not, again, HIPAA kind of precludes me from going into too much depth and things that I'm not at liberty or doesn't wish to be discussed. At some future point, maybe, but today, sorry. I think that's it. Yeah.
Thank you, guys.
Thank you.
Thank you.
Thank you.
Thank you.
All right, you've been watching the president's team at Walter Reed Medical Center, notably his personal White House physician, Sean Conley, doing most of the briefing there. I want to just summarize a few things, and I'll bring in our senior medical correspondent, Dr. John Torres. But just to summarize, the team saying that the president continues to improve. He is going home around 6:30. The president tweeted he will be Eastern time heading back to the White House. His doctor saying he may not be entirely out of the woods yet, but that he's improving. He said everything looks great in terms of his vitals and other testing that they did this morning. He will be surrounded by, in their words, world-class medical care at the White House. Did not clarify where exactly he'll be allowed to be inside the White House complex. He was given a third dose of remdesivir yesterday. We'll get a fourth before leaving tonight. And then the fifth dose of that drug will happen tomorrow. Dr. Torres, he did also say we are in uncharted territory here because this patient has had a series of medicines, a grouping of medicines that really no one else, very few people in the world have had this early in the virus.
And Kate, that's one of the things they said that kind of piqued my interest, that they're in this new territory of giving him these medicines, giving him the 3 medicines, but early on in the course of coronavirus or COVID-19, which they usually reserve until patients are further along and they're more severely ill. And so they don't exactly know how that's going to do over the long term here. And like you mentioned, they said, he's not going back to a normal house. He's going back to a place with 24/7 care. There's going to be physicians, there's going to be PAs, there's going to be nurses on hand. There's a lot of things they can do there. And so it's essentially going from a hospital to a hospital type setting, although they don't have the intensive care services they have at the hospital. And one of the other things he mentioned, again, like you said, that he's not out of the woods. But they did say that when he goes to the White House, we aren't going to miss anything that we catch here. And what we're seeing right now, when they gave us the vitals, they gave us all that, is a snapshot into what his condition is right now. But it's just that, it's a snapshot. And as we know with coronavirus, this thing can change very quickly. That 7 to 10 day time period, which is, depending on how you look at it, sometime between Wednesday and the end of the weekend. That's the crucial time period. That's when they're really going to have to follow him closely. They also said they're monitoring his viral load through these testings, and they'll know when he's no longer infectious. That's interesting as well, because that's not something we typically do. So it'll be interesting to see how that goes over the next few days and over the next week or so, Kate.
Dr. John, stand by. Let me go to Dr. Vin Gupta, who's also with us. He's an ICU doctor, an NBC News medical contributor. You treat patients with COVID all the time. What did you hear there in that briefing? And does this sound like standard care or something very exceptional for the President of the United States?
It's definitely the latter. This does not sound like anything I know my colleagues and I have been doing since March, which is evidence-based medicine, or at least willing to discuss cases openly if we're going to deviate from any standard of practice. Let me elaborate here. On the NIH website, there is a website called COVID-19 Treatment Guidelines. Anybody can see, all your viewers can see, that dexamethasone is to be prescribed until hospital discharge, and then you stop it. And you should only prescribe it if somebody is on a ventilator or requiring a significant amount of oxygen. Those are the criteria. There is no criteria where you say, let's prescribe this medication, this really powerful steroid, to prevent a bad outcome. That's just not what it's approved for. Same thing with remdesivir. And neither of these drugs, one, so there's no indication for it in the president's case. And number two, he shouldn't be going home, even if it's the White House, with either of these medications. They should be administered in a rigorous clinical setting where there's frequent monitoring.
But you heard his team say again and again, he will have the same standard of care at the White House. He will have, a high-class medical team around him, 24 hours. He will be isolated in some way, although they said he may. It was unclear if he would be in the Oval Office working. He said he'll be working wherever it's safe. I guess my question is, isn't this a different situation? And is it okay to be in a White House setting when you've got that whole team around you?
Perhaps. I mean, if he has all the same types of accoutrements as an acute care hospital, then fine. We can say that it's essentially the same thing as what he's leaving at Walter Reed. But the fact remains, why is he getting treated with these agents in the first place? I think critical gaps were revealed at this press conference. Number one, why didn't they invoked HIPAA privilege when the reporters asked about chest imaging? But they were willing to share all types of other medical data.
About the lungs.
So why are they about the lungs? And that's key here, because in the setting of shortness of breath, in the setting of reported cases of multiple declines in oxygen levels, given his treatment course, one wonders, does he have pneumonia from COVID-19? And why aren't they just willing to say that? Because it would be understandable then. It would make the American people understand, all of us understand, why they're doing what they're doing. And we could put this to rest, and we'd be glad that the president's doing better. But the fact that they're obfuscating on that is challenging. The fact that he didn't comment on why he cleared the president to go out for his joyride yesterday, that has been deeply troublesome to all of us in healthcare, because we're so painstaking when it comes to infection control, and the president can clearly put others at risk. Why didn't he talk about that? He didn't talk about blood thinners. I think the president, we don't know really anything about the nuance of his labs, but we now know, relative to March, that blood thinners can be an important part of therapy. What's wrong with sharing is the president or not getting standard of treatment for blood thinners? It's a major component of COVID-19 therapy. So critical details were left out. I think we don't have a fantastic amount of information about what's actually occurring, but it's good to hear that the president's doing better per their report.
Well, let me go to Chief White House Correspondent Hallie Jackson. She's at the White House. Hallie, to pick up there, it would seem that the doctor was told by the president what he could release and what the president is not comfortable with him releasing, because there were several times when he invoked HIPAA, at times when he didn't want to go further. And you would guess that that's an individual, here the president, saying, I don't want that publicly revealed.
Well, you heard as much, it seemed, Kate, from the end of that news conference, and he was taking questions where he said something, and I'd have to go back and listen to the tape, about how doesn't wish for it to be discussed, essentially. And it was almost, frankly, a cherry-picked HIPAA situation, because Dr. Conley was revealing some very personal and medical information about President Trump in some instances, but not in other instances, which, of course, leads to the question, why? Why is that, right? Why did we get no answer, for example, on the pneumonia question, on the lung scan question? Why are we getting no answer on the last negative test? That is so important, because as my colleagues in the White House press corps who are at Walter Reed point out, that determines who potentially could have been exposed to President Trump while he was contagious. We did learn about some other symptoms. He no longer has he no longer has a cough, for example. He has no fogginess from some of these medications, sort of mentally. That had been a question about a potential side effect. But what was interesting to me was that Dr. Conley was taking, in some ways, the role of the president's spokesperson out there, not from a medical perspective, but perhaps from a political one, saying, yeah, he's back. He's ready to get out there. He's ready to go. His medical assessment. But of course, that is something that President Trump would want Dr. Conley to say. We know that the president, as we've talked about, is an impatient patient. He wants to get out of the hospital. Kate, I don't know that anybody wants to be in the hospital any longer than they have to be. But Dr. Conley acknowledging, I think importantly, that the president is still not out of the woods yet. He didn't nail down when specifically he felt like the president would be able to leave isolation, nor, interestingly, Kate, did he specify where the president would be in isolation. We know the president will be at the residence, obviously, but there's a question, does he go to the Oval Office, which is in the West Wing, of course, a separate part of the building, to do his work? Dr. Conley made it sound like that will be an assessment that they will take moving forward. He also, when it came to that negative test, said he didn't want to go backwards and talk about things that happened in the past. But, Kate, as you know, and as our medical experts experts here on this broadcast know, that is so important when it comes to figuring out who else could be at risk. Going backwards is how you determine that piece of the puzzle. Especially, Kate, that is relevant when we know that there are now 14 people total, 13 other than President Trump, linked to the White House and campaign who have tested positive for the coronavirus in recent days. So this is clearly something that there needs to be more discussion about, more questions about, and frankly, it'd be nice to get some more answers about it, too. Kate?
White House correspondent Peter Alexander is outside Walter Reed Medical Center, and I just want to go to him because, Peter, it's a scene behind you there. I imagine for his supporters, this is exactly what they wanted to hear.
Yeah, that's exactly right. The numbers have swelled, maybe 50, growing into 100 over the course of the day. A lot of honking as folks pass by Walter Reed in anticipation of the president's departure today. Many of them still celebrating the moment they got to see him yesterday and that much scrutinized, much criticized impromptu drive-by here. But I'm struck by the president's tweet a little bit earlier today, Kate, when he announced his departure from Walter Reed. He said, among other things, don't be afraid of COVID. Don't let it dominate your life, which is going to be an interesting message from this president as we head into the election now less than a month away, given the fact that more than 200,000 Americans have already died. How that will sit with many Americans, with the families of those who have lost their lives. We know the president is trying to turn the conversation away from COVID. Obviously, these last several days have made that increasingly challenging. It's clear that that's his desire again, but whether Americans don't view this as a frightening, contagious, infectious disease at this point because the president may be going home with elite doctors and access to an exclusive array of drugs, I'm not sure how that message is going to go for most Americans.
Peter, thank you. Quickly, I want to go to Joseph Fair, who's a virologist and a contributor to NBC News. On what Peter just said, this messaging that the president's putting out there that COVID isn't so bad, what is that from a public health perspective?
It's a disaster, Kate. I mean, you're telling everyone that supports you to ignore COVID. You had the best care. You got experimental treatment very early on. They knew the moment that you were positive, just because the test is being done on you daily, several times per day. And your average American doesn't have access to that. And, as Peter just said, the families of over 200,000 individuals would tend to disagree that COVID is nothing to be worried about. And, if I may, Kate, I noticed in the press conference, one thing that you would not get the physician to say is that the president is virus negative. So he is knowingly discharging a positive patient, which to my knowledge would not happen in any other case, back to a home setting where they're going to run into administrative personnel as well. And I find it really hard to believe that you can implement hospital-level infection prevention and control in the White House, especially if you're going back and forth between the East and West wings.
They say that they're working on that. As Hallie Jackson said, there are a lot of questions to be answered in the hours to come. Joseph Fair, thank you. Thank you to all of our contributors and our correspondents who have been with us. We will have much more, as you may imagine, on Nightly News. Lester Holt is in Miami tonight. He's also hosting a town hall live from Miami with presidential candidate Joe Biden. That starts at 8 p.m. Eastern, 7 Central. But first, Nightly News before that. I'm Kate Snow. For all of us at NBC News, have a good day.
are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home.
Let's bring in NBC News senior medical correspondent Dr. John Torres. Dr. John, given what we know about the president's condition, given that he's just a few days into his coronavirus diagnosis, what are your concerns about his release tonight?
And my concerns are exactly what he said towards the end there, that since he's not out of the woods yet, which means that he still has ways to go in his coronavirus program here in the whole way his disease is going to spread out, because mainly with coronavirus, that 7 to 10 day window is the important window. But the other thing Dr. Connolly, his doctor, said is he is going to be around 24/7 care. And he went on to say there's going to be doctors, there's going to be PAs, there's going to be nurses, there's going to be a lot of care at the White House. So this is not like you or I going home, we have to take care of ourselves. This is essentially him going from a hospital setting to him going to something that's almost like a hospital setting. But again, that critical 7 to 10 day window, which for him, looking at when things started, would be sometimes towards the end of this week into the weekend and through the weekend. That's when things could turn bad. That's when things could turn critical very quickly. And so the concerning thing is you don't want him to be outside of the hospital setting where they have intensive care units if he's starting to get bad and they need to put him on a ventilator, because then you have to transport him on a ventilator, and that's always a difficult and could be a dangerous thing to do. So you have to be very careful there. But again, remember, he's going to have a lot of care around him. The other thing he said is that we're cautiously optimistic of what's going on right now, but we're also very guarded to make sure things don't happen. The vitals we saw today, the vital signs, what you're talking about the president, that is just a snapshot in the whole progression of this disease. And so we'll know as days go on what's going to happen, how it's going to pan out, and particularly what's going to happen in that 7 to 10 day window, Allison.
Dr. John, let's talk about what else we've been seeing today. I mean, the list of White House staffers testing positive just keeps growing. Press Secretary Kayleigh McEnany announcing this morning she has COVID. Sources familiar say 2 of her deputies have also tested positive. How can the administration get this White House outbreak under control, especially as the president is about to head back there?
And Allison, I think the biggest word, face masks. Face masks, social distancing, those 4 W's that you and I talk about almost every time. Wear a mask, watch your distance, wash your hands, and open windows. Those are things that they need to do. And if you look at the particular White House briefing that went on that we think is probably the super spreader event for this whole thing, that was the SCOTUS announcement that went on last week. And if you look at pictures of that, you see numerous people, both inside and outside, not wearing masks, shaking hands, hugging, doing all those things that we've constantly warned against doing. And so I know the president tweeted out last night, he sent out a message, a video saying, hey, he's learned a lot about COVID. He's learned a lot about coronavirus, and he's going to come out with some facts about coronavirus. Hopefully those facts he comes out with are wear a mask, social distance, do those things that they have not been doing. And so that's one way they're going to get it under control. On top of that, they need to make sure that contact tracing gets done very well, because in this case, they know where it probably started. They know the people that are involved. Those people, up to now, I think the number is 14, including the president, have tested positive. They need to contact trace the people around them too, put them in quarantine so they don't spread it any further. That's the best way to keep this under control. But looking forward, future-wise, again, Allison, I can't say it simply enough, wearing masks.
Yeah. You said it for how many months now, Dr. John? Masks are the thing. We certainly should know that by now. Let me ask you a quick question about the CDC before we go. Updating its COVID-19 guidance again today, saying, quote, COVID-19 can sometimes be spread by airborne transmission. These viruses may be able to infect people who are further than 6 feet away from the person who is infected or after that person has left the space. Your reaction to that updated guidance today, especially after the CDC updated and then removed similar guidance from its site last month? I think people are getting a little confused.
It is very confusing because they're giving across a confusing message. But what they did is they removed it so they could, because that was a draft form, according to them, should not have been placed online. And they removed it to make sure that they could have other experts look at it. And now they're saying, hey, okay, this has been vetted. Now we're looking at this. What they're saying is, if you look at the bottom line, it says that it's much more common to do it through those respiratory droplets at 6 foot distance, but it's possible it could be even further, those airborne, smaller droplets that could linger in the air. And so that's why ventilation and masks are so important. And you and I have talked about this, 6 foot, that's a starting distance. The further away you can get, the better. But they're finally meeting up with what other experts are saying around the world. And that's good. Hopefully we get this consistent message from now on.
Yeah, we may have been getting some confusing guidance, but certainly not from you, Dr. Torres, always reminding us, wear a mask. Thank you so much.
You bet.
Hey everyone, I'm Allison Morris. You're watching NBC News Now. Let's go to NBC News correspondent Simone Boyce. She's got the very latest headlines from NBCnews.com. And Simone, it is a very busy Monday. I won't keep you. We'll let you go.
Hey, Allison, and good afternoon, everybody. We start here. Today, the World Health Organization announced that roughly 1 in 10 people worldwide may have caught the coronavirus. That's 20 times the amount of confirmed totals, which some health experts claim is an undercount. Well, Governor Cuomo says schools from 9 New York City zip codes will need to close once again due to an uptick in COVID-19 cases. However, indoor dining and non-essential businesses can stay open, at least for now. And forecasters say Tropical Storm Delta could make landfall along the Gulf Coast by this Friday. It'll likely be the first time on record that 10 named storms made U.S. landfall in one season. And the Supreme Court struck down an appeal from former Kentucky County Clerk Kim Davis today. She became well known 5 years ago after she stopped issuing marriage licenses to same-sex couples due to her religious beliefs. And 3 scientists, including 2 American researchers, have won the Nobel Prize in Medicine. The scientists were honored for discovering the hepatitis C virus. So congratulations to them. Those are your headlines for now. Allison, I'll see you soon.
All right, Simone, thank you so much. President Trump just announced he'll be discharged from the Walter Reed Medical Center tonight at 6:30. The president tweeting that he's feeling, quote, really good, telling his followers not to be afraid of the coronavirus. Earlier today, White House Press Secretary Kayleigh McEnany announced she's tested positive for the coronavirus. 2 of her deputies also reportedly have COVID. That's according to 2 sources familiar with their diagnoses. NBCnews.com senior White House reporter Shannon Pettypiece joining me now from the White House. Shannon, Kayleigh McEnany announcing her diagnosis today. In her statement, she said she tested positive this morning after, quote, testing negative consistently, including every day since last Thursday. Yesterday, she spoke to reporters without a mask. Shannon, as a member of the press pool, what can you tell us about safety protocols at White House briefings? And what is the White House saying about potential exposure here for reporters?
Well, around the White House, reporters, the White House Correspondents Association, there are measures that have been put in place requiring people to wear masks when they're in the briefing room, when they're in the workspace, and really discouraging people to come to the White House. So only really essential reporters who have an enclosed workspace, who have a designated seat in the White House press work area, have been told to come in. And even in the last few days, they've encouraged people to really cut back on that, and a number of reporters have. I was briefly over there today, and it was a very thin number of reporters. Now, as you can see, a lot of times in this video here, McEnany or other White House officials come outside and talk to reporters. The vast, vast majority of times, those officials don't have masks on. The reporters always have masks on. A similar thing in the briefing room, which, again, is an indoor enclosed space. So according to CDC guidelines, that's an elevated risk compared to being outdoors. As you have seen multiple times, the president, McEnany, other officials in that briefing room continue to talk to reporters without masks on. And there was a briefing earlier this week. It was after Hope Hicks had tested positive, where McEnany came out and briefed reporters. At that time, she said that she was not aware of Hope Hicks' prognosis, had not been told that she was a close contact to Hicks. But of course, McEnany, Hicks are both very close advisors to the president. They're among those senior staffers who are regularly in meetings. I saw on Friday there was a large group of staffers all grouped together in McEnany's office in masks, I will say, but a gathering for at least an hour spent together. So all of these staffers having a lot of interaction with each other. And so, you know, of course, probably not surprising given what we know of this virus, that this infection continues to spread throughout the White House.
Shannon, I know the president just announcing that he is leaving Walter Reed Medical Center after being there for about 4 days. He's due to leave around 6:30 tonight. What else do we know? I know this is news breaking just a short time ago.
Well, we don't know much about how the status of his condition today. He tweeted that he feels really well and, quote, "I feel better than I did 20 years ago." We have not heard from his doctor today. We're expected to get a briefing shortly from his physician before he is discharged. Of course, being sent home from the hospital to the White House is much, much different than the rest of us being sent home from the hospital. The White House has a full medical suite set up. They have an operating room here. There's a number of things they can do from the White House, really aside from having a CT scan or a big diagnostic device. But the White House is set up to handle a lot of medical issues just in general, everything from a president having, the flu to a president being shot, as has happened in the past in history. So the president will continue to have medical support. We don't know about what his setup's going to be like, if he is going to be confined to the residence, how much longer he plans to quarantine, if he's going to isolate from the First Lady, who is at the residence and continues to be there. But the president expected to be back around 6:30 this evening. After that would make it about 4 days, actually since Friday evening, around 6:30 is when he left to go to Walter Reed.
Listen, you said it just a moment ago, Shannon, that we don't really know that much more about his condition. Let's talk for a minute about the mixed messaging that we've been getting, quite frankly, since the president was diagnosed last week. Throughout the weekend, it just seems like we haven't really gotten a good fix on how he's doing and exactly what his conditions or his symptoms are.
Right. And the White House physician and another senior administration official essentially acknowledged over the weekend that publicly they have been giving a rosier picture because that is what the patient has wanted. After the fact, we have learned the president had supplemental oxygen at one point at the White House, said he had a high fever. That there were some really concerning things going on when he was at the White House on Friday. He's had some ups and downs in the hospitals, we have learned, but that information usually has come after media reports have leaked or after other administration officials have told reporters the information on background, not coming directly from his physician. So the information we will receive later today, or we're anticipating receiving later today from his physician, of course, I think a lot of people at this point are going to be taking that with a bit of a caveat, because about 3 or 4 times now his physician has been contradicted by other information that has come out that he has later had to clarify.
Let's talk about one issue over the weekend that has gotten a whole lot of attention. The president briefly leaving the hospital, making a surprise visit to his supporters outside. Medical experts are criticizing the president for this because he was riding with Secret Service agents in a vehicle that is hermetically sealed to protect the president. And by that, it keeps all of the air, any potential coronavirus droplets inside, potentially exposing those Secret Service agents to COVID. The president's former campaign manager, Corey Lewandowski, defended that move today.
President Donald Trump in the White House. So thank you all very much.
Vice President.
The coronavirus is having ripple effects on Capitol Hill. The Senate taking a 2-week break after 3 Republican senators tested positive for COVID-19. So how will this impact the coronavirus relief negotiations? The president tweeting from the hospital, quote, "Get it done." NBC News correspondent Heidi Prisbilla joins me now. Heidi, what is the latest from House Speaker Nancy Pelosi, Treasury Secretary Steve Mnuchin? Are they talking again this week after House Democrats passed that $2.2 trillion stimulus bill last week?
We're just learning this morning, Allison, that indeed they did talk today and they plan to talk again tomorrow. That comes after Pelosi on Friday struck a really optimistic tone that maybe, just maybe, they can get something done. Now, the House is out, but that doesn't mean that if a deal was struck that members couldn't be called back to cast a vote. That said, they still have some major sticking points on this, including the money to state and local governments. There's still several $1 million apart. But you see now the president also, for the first time, really inserting himself there now, tweeting about it. You really see a sense that all sides want to get something done. We have not gotten relief to the American public in many, many months, even though the House is coming back, repeatedly lowering the original amount that they were asking for. So you do get a sense that there is some kind of cautious optimism. But again, they do remain far apart on some significant points, Allison.
This could also potentially affect the confirmation hearings for Supreme Court nominee Amy Coney Barrett. They are supposed to start a week from today. As we mentioned, 3 GOP senators testing positive for the virus. 2 of them are on the Judiciary Committee. How could that potentially affect this confirmation timeline?
The Senate Majority Leader, Mitch McConnell, says it's full steam ahead. However, all of the members, Allison, have potentially, and I say potentially because they were all in a meeting together just last Thursday, where you had known coronavirus positive senators, Mike Lee and Tom Tillis, sitting in that meeting room for an extended period of time. So there's going to be a couple of important variables here. First, what havoc does the coronavirus wreak, not just on the Judiciary Committee, which all of those members now, I know based on my own reporting, are scrambling to get tested, but also what kind of procedural rules can McConnell use to try and thread this needle? Because he can do virtual hearings, which the chairman, Senator Lindsey Graham, has said they're going to do. But when it comes to a vote, right now the standing rules on that committee require that all of those senators vote in person, not that they have proxies. And it's the same issue when a vote would come to the Senate floor. So again, a lot of this depends on how much they can pace this out and just cross their fingers that no more of these committee members, and indeed the entire Senate conference, gets really sick with this. Because once it does get to the floor, again, has to be all of them in person. And we already know of 2 GOP senators who have said no dice. Senator Susan Collins and Lisa Murkowski have said they don't support this. So Senator Mitch McConnell really does not have much room for margin of error here. He cannot afford for this to be impacted by senators actually being out sick. And even though Senator Ron Johnson said he would come in a moon suit to vote, even if he's still sick, that's going to draw some backlash, I would think, from many of the senators. If you see known coronavirus positive senators threatening to come and vote on the floor in person when they are infected with the coronavirus, Allison.
Yeah, it's a scary thought there for sure, Heidi. We hope nobody else gets sick there and that they find a way to figure this out without bringing sick folks to the floor. Heidi Prisbilla, thank you so much.
Thank you.
Nearly 3 out of 4 Americans think the president didn't take proper COVID-19 precautions. That's according to an ABC News poll. Here's what else voters around the country are saying about his diagnosis.
As weird of a thing to say, it's a good thing for him, and more so a good thing for the nation, to show as an example that even if you have tested positive for COVID, we shouldn't be manifesting so much fear. And I think he'll be a good example of how we can show that we're strong and not be afraid.
You know, he got what he bargained for, you know. He wasn't paying attention to the rules, and I think he got what he deserved, to tell you the truth.
Well, I've always thought, and I think the president thinks it's a serious disease, and I think it's unfortunate that he got it. I don't think it's his fault. this disease was caused from something in China and that it is not his fault.
That the president knew he had been close to Hope Hicks, who he knew was infected, and he went there anyway. Shows me that the White House staff and the people around him have no capacity to control the man.
I think if he comes out beating the virus, I suppose you could say, then it just should give courage and strength to people to recognize that it's something that has such a good survival rate for most, and to not live in fear.
I think that hopefully people that have been listening to him that don't think this is real, that they think it's some sort of a Chinese hoax, will take it seriously. I mean, that's what I hope happens out of this. I don't want to see anybody get sick. I don't want to see anybody die. But as the leader of the free world, and the way he's just written this thing off as like some sort of a fantasy, the reality set in for him now.
The Supreme Court starts a new term today. It's first since Justice Ruth Bader Ginsburg's death. That means that just 8 justices are set to hear arguments on several high-profile issues, including a case that could decide the future of Obamacare, not to mention any potential disputes over the presidential election. NBC News Justice correspondent Pete Williams joining me now from Washington, D.C. Pete, there are 8 justices right now as we await the Senate confirmation hearings for Judge Amy Coney Barrett. Her confirmation could have an impact on all of these cases. So let's just talk about that first. How quickly could she be confirmed and seated on the Supreme Court?
Well, as you just heard from Heidi, who knows? I mean, she could be confirmed before the election. She could be confirmed perhaps late November. It depends. Well, I think it'll be important if she gets confirmed by election, because just the week after the election is when the Supreme Court hears the Obamacare case. But as you noted, the Supreme Court's term has started now. She will not participate in the first dozen or so cases that are going to be argued this month, because the Supreme Court's practice is you have to be on the court, sitting on the court as a member, in order to vote on any cases that were argued. If you came on after they were argued, it's too late.
So let's talk about what happens right now while there are just 8 justices. What if there's a tie?
If there's a tie, and it happens quite often, then the lower court ruling stands. It's as though the case never came to the Supreme Court. Whoever won below, whoever appealed, the ruling stands that was issued by the court below that's being appealed. So it can't be cited as precedent. The court just issues a very short thing that says the decision below is affirmed by an equally divided court, but it has no precedential value.
Pete, you said it. The court is scheduled to hear the challenge to Obamacare on November 10th. 18 states challenging the individual mandate, which requires that all Americans have health insurance or pay an income tax penalty. The Supreme Court first upheld Obamacare back in 2012. Could you talk us through some of the arguments this time around?
Well, the big issue is the individual mandate. In 2012, the Supreme Court said, yes, it's true. Normally, Congress has no power to require you to go out and buy something. But the Supreme Court upheld Obamacare, saying it was a legitimate use of Congress's taxing authority, because people who didn't buy health insurance would have to pay a penalty on their income tax. So when the Republicans controlled Congress, they said, aha, we'll just set the tax at 0. Therefore, the thing that saved Obamacare is gone. So the question is there still an individual mandate that's valid? The red states say no, because there's no tax to save it. The blue states say, well, with no penalty, there really isn't a mandate, so there isn't much of a mandate. But I think the central issue is, even if the Supreme Court said, yes, that individual mandate is unconstitutional, what about the rest of the law? That's the key question. The red states, with the Trump administration, say, well, then the whole law has to fall. It's all one big thing, and you can't just pull parts of it apart. The whole thing collapses. The blue states say, no, just take out the individual mandate and leave the rest of the law intact, such as the pre-existing conditions coverage requirement.
Pete, I know the court will also consider whether the Constitution provides a religious freedom exception to anti-discrimination laws. Could you tell us about that case?
Right. This is a case from Philadelphia. In that city, as many cities do, they have a system for taking care of children that need to be sent to foster care. What they do is they contract with nonprofit agencies to handle that. And one of the agencies they contract with is Catholic Social Services. The city discovered that Catholic Social Services has a position that it will not send children to same-sex parents. And when the city found out about that, they said, well, you're violating the rules of the contract. We have a non-discrimination law here in Philadelphia, so you can't participate in this program. Catholic Social Services sued. So the question is, when you have these conflicts between religious values and a non-discrimination law, which one takes priority? Now, this is the same issue the Supreme Court dodged a couple of years ago in the so-called Masterpiece Cake case from Denver about the baker who didn't want to bake cakes for same-sex weddings. And the question was there, Colorado had an anti-discrimination ordinance. He had religious views. The Supreme Court ducked the issue then, so it's still unresolved. And, you know, my guess is they may duck it again because there are enough sort of procedural difficulties with this case, that enough sort of off-ramps that the Supreme Court could find a way to dispose of this case without deciding that big question.
Pete, some big cases this term, and of course we will be watching to see what happens with Amy Coney Barrett. Thank you so much.
My pleasure.
You're watching NBC News Now. We've got some breaking news.
If they do go back to their jobs, they want to make sure that they are protected.
It's news made for your streaming world. Live weekdays starting at 6 a.m. Eastern.
Firefighters have had more favorable conditions, allowing them to push the flames away from homes, but the wind can change all of this on a dime.
We can continue to expect protests as people continue to call for more answers to what happened and continue to call for that accountability.
Starting to feel like a typical general election. Both candidates actually out on the campaign trail making their pitch to voters.
The moment to truly understand who we are and who we say we are is right here at our feet.
You got to get a four-year degree, but a four-year degree is super expensive. We have created a system where the ticket to the middle class is a thing that middle-class families have to stress about and borrow for and patch together.
Why is this happening? With Chris Hayes. Subscribe now.
For breaking news in our changing world, download the NBC News app.
This morning across the country, what the new normal for schools will look like.
Many teachers left making tough choices between the job they love and their family.
What am I going to decide? Take care of my children or have a job?
That's an impossible decision.
You're creating a little community school. This is a moment where we can just develop ourselves and develop our community.
Let's turn it over to students. How do they really feel about returning to school?
What I miss is my teachers.
They are resilient.
Today's headlines can be hard to understand, and a lot of kids have questions, so we started a newscast for them. We hope your family will watch Nightly News Kids Edition.
The person leveling the accusations isn't me, it's John Bolton. I have heard from sources, and you guys have reported, that Dr. Fauci, through Secretary Azar, had been banging the pots and pans very early in the year. I worked on campaigns. If that was a campaign event, it was a crummy one.
Deadline White House is now 2 hours. Weekdays from 4 to 6 on MSNBC.
Protests broke out. The coronavirus pandemic.
The story.
Emergency approval to treat COVID-19 with plasma. Many questions remain about how well it works.
From every angle.
How much of the increased tension was due to the militias that came here?
On the ground.
Deadly western wildfires in California.
Entire communities were also wiped off the map.
And in depth.
One of the big concerns is indoor air quality. What are you doing to address that?
NBC Nightly News with Lester Holt.
Early voting kicking off in South Carolina, an unexpected battleground state that could decide control of the Senate. Well-funded Democrat Jamie Harrison giving Senator Lindsey Graham a run for his money. NBC News correspondent Leanne Caldwell joining us now from North Charleston, South Carolina. Leanne, first, we're seeing some long lines in South Carolina. How has the voting been going there today?
That's right, Allison. There were long lines wrapping around this building. This is a Coliseum. All morning, starting from when before the polls opened at 8:30 through about lunchtime. Then there was a steady trickle throughout, and things are starting to pick up again. But it looks like that this is something new for South Carolina because of COVID. They are having this no excuse absentee in-person voting, which is essentially early voting. And, you know, they were expecting big turnout today, and they're expecting big turnout through the month. And I think that that's what they got. There's also another way to vote, which is absentee mail-in voting. More than 180,000 people have requested those ballots in this state. So it seems like both sides are really fired up for this election, Allison.
Leanne, let's talk about that battle for the Senate there. Harrison's campaign has raised tens of millions of dollars. What is the state of that race today?
Yeah, and you know, it's not only the presidential race, it is a big race here. Like you mentioned, it's that Senate race as well, which, you know, even 6 months ago, no one expected was going to be a battleground. But the fact that incumbent Republican Senator Lindsey Graham is at risk of losing his seat here to a Democrat is really big news. This is a conservative state. It's a Republican state. And so, you know, as far as the status of the race, it's almost like a perfect storm for the Democrat, Jamie Harrison. He's well-funded. He has a lot of money. He's expecting big turnout, especially from African-American voters, especially with Joe Biden at the top of the ticket. Remember, Joe Biden's candidacy turned around here in the primary. Kamala Harris is on the ticket as well, which is also expected to boost turnout. And Senator Graham is really struggling. He's struggling among women voters, just like the president. And he's also working to have to shore up the Republican base. The reason is because the very enthusiastic Trump supporters don't necessarily trust Lindsey Graham. They remember his position on comprehensive immigration reform. They remember how he criticized the president in 2016. And so Graham is having to do a lot of work to ensure that the Trump voter also votes for him on Election Day. Allison.
Liam, Graham and Harrison had a pretty fiery debate over the weekend. My favorite part, Harrison brought his own plexiglass. Could you tell us more about the fireworks on that debate stage and the biggest issues they got into?
He did bring his own plexiglass, and of course that's to protect himself as all these Republicans are being infected with coronavirus up in Washington. The president, Lindsey Graham is a close ally of the president, member of the Judiciary Committee. 2 members of the Judiciary Committee have tested positive for COVID. And so Graham had that Harrison had that plexiglass. But another thing that happened at the debate, which was extremely fiery, is that Senator Graham really kept coming back to this issue of Amy Coney Barrett and his leading role in ensuring her confirmation, which he hopes before Election Day. Let's listen to what he had to say about that.
We're not going to stop doing our job in Washington. As chairman of the Judiciary Committee, I promise you, we're going to get Judge Barrett on the court safely.
Thank you, sir.
And that goes back to what I was just talking about, where Lindsey Graham is trying to shore up the Republican base. Graham is betting that pushing through Amy Coney Barrett is going to motivate those conservative voters, not just to vote for Trump, but also to vote for him on the ballot. Allison.
Leanne, Harrison pushed back on Graham, saying that the focus in Washington should not be on confirming a new Supreme Court justice. What does he think that lawmakers should be focusing on and worrying about right now?
Yeah, well, Harrison has the position of many of Harrison and Biden supporters here. Then that is that they should move on a Supreme Court nomination after Election Day, or perhaps after the inauguration, depending on who wins. Harrison said that COVID needs to be a focus, and also that COVID relief legislation that is stalled in Congress. Here's how Harrison put it at that debate.
Right now, there is a bill sitting on Mitch McConnell's desk in order to take up. This state is suffering. Our businesses are shuttering. People are dying. There, as you mentioned earlier, there are not enough tests. But the urgency is to push the Supreme Court justice, even when they have 2 members of the Judiciary Committee who have COVID. But they have not moved at all on addressing COVID.
Senator Graham is also trying to paint Harrison as someone who is associated with what he is calling the radical left, tying him to Speaker Pelosi and Democratic leader Schumer. But Harrison is insisting that he will be an independent voice for South Carolina, saying he does not support defunding the police, saying he does not support the Green New Deal, calling it too partisan and too expensive. So, you know, they really drew a contrast with each other at that debate this weekend. And, you know, it's just setting the parameters of this final stretch of this election, Allison.
Quite a race there for sure. Leanne Caldwell in South Carolina, thank you so much.
Thank you.
In-person absentee voting started in Maine today, and there are two big races in the state. In the presidential race, Maine is expected to break for Joe Biden. But the big question, will Republican Senator Susan Collins' seat flip back to the Democrats? NBC News correspondent Maura Barrett joining us now from Lewiston, Maine. It's just north of Portland. Maura, Susan Collins won her fourth term with 68% of the vote. But this year, she's lagging behind Democratic challenger and Maine Speaker Sarah Gideon. What are you hearing from voters about that race?
Yeah, Susan Collins was a longtime favorite here in Maine, seen as one of the top bipartisan senators in Washington, D.C., but we're seeing that loyalty kind of shrink over the past couple of years since the Trump administration took office. And while Susan Collins has largely kind of tried to keep arm's length from the president, people here in Maine are really not pleased with her vote for Brett Kavanaugh a couple years ago. And now that's coming back up into the conversation now that we're seeing another Supreme Court justice confirmation looming possibly ahead of the election. And now this poll that was recently out from Colby College puts Sarah Gideon about 4 points ahead of Susan Collins. And it also points out that 60% of Mainers are against a Supreme Court justice confirmation and vote ahead of the general election. And that's something that Susan Collins also agrees with. She said that she would not vote for a justice ahead of the general election because she thinks that whoever the next president is, or if it is still President Trump, that they should make that decision after November 3rd. But all in, it's really soured a lot of the voters that I've been speaking to here in line as they go to cast their absentee in-person ballots today. But some of them are just, they're willing to give Sarah Gideon a shot, even though they do note that Collins has the experience that they think would be necessary in D.C. But I want you to take a listen to Bob about how he weighed his decision. He once was a Collins voter, but is now supporting Sarah Gideon. Take a listen. Does anything stand out to you about Sarah Gideon?
She's a new face, and I voted for her. I know there's been a lot of mud slinging, and I'm giving her a chance to go up and represent the Maine people, and hopefully she'll represent them in a good fashion. And if she doesn't, we'll have another election.
Now, Allison, what was interesting is that I did meet some Trump supporters that were voting for Collins today. I also met some Biden supporters that are going to be voting for Collins, also some Biden supporters that are voting for Gideon. And so there's kind of still this toss-up over how exactly this race will shake out. It's one of a handful of states that are needed for Democrats to flip in order to take back control of the Senate. But no matter who I talked to today, every single voter, when I asked them what their top issue was, they said they're looking for someone who can reunify the country. And that's who they think their choice can help get it done, regardless of the candidate that they're choosing. Allison?
That's a theme across the country, it seems, Maura. Maine, certainly a state to watch when it comes to that Senate race. Thank you so much. The White House doctor is giving an update on President Trump's condition before he leaves Walter Reed. Let's listen in.
And his work of breathing are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care 24/7.
Paid in employment and taxes, especially minority-owned small businesses, and make another $100 billion in low-interest loans available to those businesses to get back on their feet and stay alive. Because you know as well as I do, and ethnic communities, they are the heartbeat. They're the center of a community. Whether it's a grocery store, a beauty shop, a barber shop, the hardware store, the essence of a community. We're going to make investments to increase incomes as well. It's long past time I've worked with Governor Cuomo to get it done in New York and other governors across the country. No one should have to work 2 jobs to be able to be 40 hours a week so they're out above the poverty rate. $15 should be a minimum wage in the United States of America, period. And for our essential workers, we're not just going to praise you, we're going to begin to pay you a good wage, ensure you have strong benefits. We're going to ease the burden of the major costs in your life. And what are they? Health care. We're going to build on the Affordable Care Act, which gave 4 million Hispanic people in this country health insurance by adding a new health insurance option, a not-for-profit public option. We're going to give private insurers a real competitor. We're going to increase subsidies so your premiums are lower and you can afford plans with lower deductibles and lower out-of-pocket expenses. We're going to take on the pharmaceutical industry, a plan that slashes the cost of prescription drugs by 60%. And if you think I'm making these numbers up, if we just let Medicare negotiate independently for all the drugs they purchase, I promise you the rates are going to fall through the floor. Affordable and accessible. Every 3- and 4-year-old will have access to a free, quality preschool. All the studies at your great universities and all the ones around the country have shown that no matter what zip code a child comes from, no matter what background, if they go to preschool, not daycare, preschool, in school at 3, 4, and 5 years old, they increase exponentially by over 50%. The prospect they'll go through all 12 years and many beyond. And we'll make sure that low and middle income, and by the way, the total cost of that, it's called Title I program. We now spend $15 billion in school districts that don't have high tax rates. Well, guess what? You change that to 45. You can put every one of these kids in school, pay the teachers a legitimate rate, and make sure you have school psychologists and social workers in those schools. We're going to make sure that for child care, for someone under the age of 5 or 6, no one ever has to pay more than 7% of their income for their young children to get quality child care. Because if you truly want to reward work in this country, we have to ease the financial burden of the care that families are carrying. Even before the pandemic, and many of you know it, and many of you are doing it, millions of working families faced enormous financial and personal strains trying to raise their kids and care for their parents or loved ones living with a disability. It's going to sound strange, but when I first got elected, when I was 29 years old to the Senate, right after I got elected, my wife and daughter were killed. My 2 sons survived after hospitalized for a long time. I needed help to do my job. I could not possibly afford child care, even though I was making a really good salary of $42,000 a year, more than I had ever made. But I couldn't afford it. Being a single mom or dad or a family that has 2 people working with young children, it's incredibly costly. And by the way, and the professional caregivers out there, home health workers, child care workers, who are more often women of color and immigrants, and too often underpaid, unseen, and undervalued. That's why my Build Back Better plan will elevate the compensation, benefits, and dignity of caregivers and workers and early childhood educators. That's what we're going to do. It's also going to invest in education beyond high school. We're going to make, if you qualify to get into community college, you'll automatically be able to go, and you'll be able to go for free. If you are qualified to get into a 4-year public school in your state, public college, and your family makes less than $125,000 a year, you get to go free. If you're buying your first home, you're going to have a tax credit up to $15,000 to get there. What happened after the Great Recession and this one? An awful lot of you are in range in age from the millennials who started off back after 9/11 all the way to the people graduating this year are not in a position to do that because your jobs have been postponed or non-existent. But providing an opportunity, and get you into the system. We're also going to protect Social Security, increase the benefits for millions of seniors. We're going to do that all in a partnership and lockstep with the Hispanic community. And by the way, the president's proposal to eliminate the tax you pay when you get your paycheck for Social Security without any means by which to replace it, the actuary at Social Security said Social Security will be bankrupt by 2023. They've never liked it to begin with. So look, the success and prosperity of the Hispanic Americans is indispensable to the success and prosperity of the United States and of all America. It's that simple. Hispanic families are responsible today for $2.6 trillion of our gross domestic product, and growing. If that was a standalone economy, a country all by itself, it would be the 8th largest economy in the world. Think of that. Now imagine how much more that would grow if everyone had access to the tools they need to succeed. By investing in Hispanic communities, we're making the smartest possible investment with the greatest possible returns that our nation could make, period. You know, we also need to rebuild our ability to work with our partners throughout the Western Hemisphere to realize the enormous potential of this region and the world, to confront those leaders who continue to oppress the rights of their people. We should be leading the international effort to confront the massive humanitarian crisis in Venezuela. Maduro, who I've met, is a dictator, plain and simple, and he's causing incredible suffering among the Venezuelan people to maintain his grip on power. The Venezuelan people need our support to recover their democracy and rebuild their country. That's why I would immediately grant temporary protective status to Venezuelans as president, so the Republicans in the Senate can't keep blocking it, like they did again just last week. And I'll make sure we're supporting neighboring countries that are being overrun with immigration because of Maduro, like Colombia, which are caring for millions of Venezuelans who fled their country in desperation. I'll use sanctions as one of the tools for a comprehensive strategy that includes humanitarian assistance, international pressure, and support for democratic actors in Venezuela to force the regime to embark on the road to a free and fair election. We also need a new Cuba policy. The administration's approach is not working. Cuba is no closer to freedom and democracy than it was 4 years ago. The fact there's more political prisoners, the secret police are as brutal as ever, and Russia is once again a major presence in Cuba, in Havana. For my entire career, I stood for democracy and human rights, for freedom of the press, assembly, and religion against dictators of the left and the right. And as president, my policy will be governed by two principles. First, Americans, especially Cuban Americans, are the best ambassadors for freedom in Cuba. Second, empowering the Cuban people to determine their own future is central to a national security interest of the United States. I think it's unconscionable that the current administration is deporting hundreds of Cubans back to a dictatorship. There are almost 10,000 Cubans languishing in tent camps along the Mexican border because of the administration's anti-immigration agenda. That's the administration actively separating Cuban families by not processing visas through restrictions on family visits and remittances. I think we have to reverse that. The bottom line is that President Trump cannot advance democracy and human rights for the American people when he has embraced so many autocrats around the world, starting with Vladimir Putin. Folks, we can do this. We can reach for more as a nation. We can rebuild. We can rebuild the backbone of this country and finally bring everybody along. America's always done best coming out of crises. We're the only nation that's always come out of every crisis better than we went in. We can build a new administration that reflects the full diversity of our nation, including Hispanic communities. And Hispanic voters, especially in Florida, can help put our nation on a new path forward. And here in Florida today, as the deadline to register to vote ends today, if you haven't registered, go out right now, because it is an obligation. Every vote will make a difference. Check and make sure your family and friends are registered. And then make sure everyone you know has a plan to vote. If you can vote by mail, vote by mail. If you can vote in person, vote in person. If you can vote early, vote early. If you can vote early in person, starting on October 19th in many places in Florida, including right here in Miami. Just make sure you vote. Together we can win. We can't let this pandemic change everything. We've got to get it under control so we can get our economy working again for everyone. We can come together as a nation. I'm running as a Democrat, proud of it, but I will be an American president, not a Democratic president with a capital D. I'll fight as hard for you and your family, whether you vote for me or whether you vote against me, because there's nothing we can't do when we do it together. Folks, I've been more optimistic about our chances as a nation to own the 21st century than I've been my whole career. There's not a single solitary thing that's beyond our capacity as a nation. I mean that sincerely. The most talented workers in the world, the most incredible system in the world. We have a people who, when they stand together, have never, ever, ever, ever failed. So every time I'd walk out of my grandpa's house up in Scranton, Pennsylvania, he'd yell, "Joey, keep the faith." My grandma, when she was alive, would yell back, "No, Joey, spread it." Let's go spread the faith. Take back this country. We're so much better than this. God bless you all, and may God protect our troops. Thank you, thank you, thank you.
NBC News Now. We've got some breaking news.
If they do go back to their jobs, they want to make sure that they are protected.
It's news made for your streaming world. Live weekdays starting at 6 a.m. Eastern.
Firefighters have had more favorable conditions, allowing them to push the flames away from homes, but the wind can change all of this on a dime.
We can continue to expect protests as people continue to call for more answers to what happened and continue to call for that accountability.
Starting to feel like a typical general election, both candidates actually out on the campaign trail making their pitch to voters.
The moment to truly understand who we are and who we say we are is right here at our feet.
You got to get a four-year degree, but a four-year degree is super expensive. We have created a system where the ticket to the middle class is a thing that middle-class families have to stress about and borrow for and patch together.
Why is this happening? With Chris Hayes. Subscribe now.
For breaking news in our changing world, download the NBC News app.
This morning across the country, what the new normal for schools will look like.
Many teachers left making tough choices between the job they love and their family.
What am I going to decide? Take care of my children or have a job?
That's an impossible decision.
You're creating a little community school. This is a moment where we can just develop ourselves and develop our community.
Let's turn it over to students. How do they really feel about returning to school?
What I miss is my teachers.
They are resilient.
Today's headlines can be hard to understand, and a lot of kids have questions, so we started a newscast for them. We hope your family will watch Nightly News Kids Edition.
The person leveling the accusations isn't me, it's John Bolton. I have heard from sources, and you guys have reported, that Dr. Fauci, through Secretary Azar, had been banging the pots and pans very early in the year. I worked on campaigns. If that was a campaign event, it was a crummy one.
Deadline White House is now 2 hours. Weekdays from 4 to 6 on MSNBC.
Protests broke out. The coronavirus pandemic.
The story.
Emergency approval to treat COVID-19 with plasma. Many questions remain about how well it works.
From every angle.
How much of the increased tension was due to the militias that came here?
On the ground.
Deadly western wildfires in California.
Entire communities were also wiped off the map.
And in depth.
One of the big concerns is indoor air quality. What are you doing to address that?
NBC Nightly News with Lester Holt.
The president says he's being discharged tonight from Walter Reed. Here's what his medical team said about his condition today.
Over the past 24 hours, the president has continued to improve. He's met or exceeded all standard hospital discharge criteria. He'll receive another dose of remdesivir here today, and then we plan to get him home. It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturations and his work of breathing, are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home.
Let's bring in NBC News senior medical correspondent Dr. John Torres. Dr. John, given what we know about the president's condition, given that he's just a few days into his coronavirus diagnosis, what are your concerns about his release tonight?
And my concerns are exactly what he said towards the end there, that since he's not out of the woods yet, which means that he still has ways to go in his coronavirus program here in the whole way his disease is going to spread out, because mainly with coronavirus, that 7 to 10 day window is the important window. But the other thing Dr. Connolly, his doctor, said is he is going to be around 24/7 care. And he went on to say there's going to be doctors, there's going to be PAs, there's going to be nurses, there's going to be a lot of care at the White House. So this is not like you or I going home, we have to take care of ourselves. This is essentially him going from a hospital setting to him going to something that's almost like a hospital setting. But again, that critical 7 to 10 day window, which for him, looking at when things started, would be sometimes towards the end of this week into the weekend and through the weekend. That's when things could turn bad. That's when things could turn critical very quickly. And so the concerning thing is you don't want him to be outside of the hospital setting where they have intensive care units if he's starting to get bad and they need to put him on a ventilator, because then you have to transport him on a ventilator. And that's always a difficult and could be a dangerous thing to do. So you have to be very careful there. But again, remember, he's going to have a lot of care around him. The other thing he said is that we're cautiously optimistic of what's going on right now, but we're also very guarded to make sure things don't happen. The vitals we saw today, the vital signs, what you're talking about the president, that is just a snapshot in the whole progression of this disease. And so we'll know as days go on what's going to happen, how it's going to pan out, and particularly what's going to happen in that 7 to 10 day window, Allison.
Dr. John, let's talk about what else we've been seeing today. I mean, the list of White House staffers testing positive just keeps growing. Press Secretary Kayleigh McEnany announcing this morning she has COVID. Sources familiar say 2 of her deputies have also tested positive. How can the administration get this White House outbreak under control, especially as the president is about to head back there?
And Allison, I think the biggest word, face masks. Face masks, social distancing, those 4 W's that you and I talk about almost every time. Wear a mask, watch your distance, wash your hands, and open windows. Those are things that they need to do. And if you look at the particular White House briefing that went on that we think is probably the super spreader event for this whole thing, that was the SCOTUS announcement that went on last week. And if you look at pictures of that, you see numerous people, both inside and outside, not wearing masks, shaking hands, hugging, doing all those things that we've constantly warned against doing. And so I know the president tweeted out last night, he sent out a message, a video saying, hey, he's learned a lot about COVID. He's learned a lot about coronavirus, and he's going to come out with some facts about coronavirus. Hopefully those facts he comes out with are wear a mask, social distance, do those things that they have not been doing. And so that's one way they're going to get it under control. On top of that, they need to make sure that contact tracing gets done very well, because in this case, they know where it probably started. They know the people that are involved. Those people, up to now, I think the number is 14, including the president, have tested positive. They need to contact trace the people around them too, put them in quarantine so they don't spread it any further. That's the best way to keep this under control. But looking forward, future-wise, again, Allison, I can't say it simply enough, wearing masks.
Yeah. You've said it for how many months now, Dr. Don? Masks are the thing. We certainly should know that by now. Let me ask you a quick question about the CDC before we go. Updating its COVID-19 guidance again today, saying, quote, COVID-19 can sometimes be spread by airborne transmission. These viruses may be able to infect people who are further than 6 feet away from the person who is infected or after that person has left the space. Your reaction to that updated guidance today, especially after the CDC updated and then removed similar guidance from its site last month? I think people are getting a little confused.
It is very confusing because they're giving across a confusing message. But what they did is they removed it so they could, because that was a draft form, according to them, should not have been placed online. And they removed it to make sure that they could have other experts look at it. And now they're saying, hey, okay, this has been vetted. Now we're looking at this. What they're saying is, if you look at the bottom line, it says that it's much more common to do it through those respiratory droplets at 6 foot distance, but it's possible it could be even further, those airborne smaller droplets that could linger in the air. And so that's why ventilation and masks are so important. And you and I have talked about this, 6 foot, that's a starting distance. The further away you can get, the better. But they're finally meeting up with what other experts are saying around the world. And that's good. Hopefully we get this consistent message from now on.
Yeah, we may have been getting some confusing guidance, but certainly not from you, Dr. Torres, always reminding us, wear a mask. Thank you so much.
You bet.
The coronavirus is having ripple effects on Capitol Hill. The Senate taking a 2-week break after 3 Republican senators tested positive for COVID-19. So how will this impact the coronavirus relief negotiations? The president tweeting from the hospital, quote, "Get it done." NBC News correspondent Heidi Prisbilla joins me now. Heidi, what is the latest from House Speaker Nancy Pelosi, Treasury Secretary Steve Mnuchin? Are they talking again this week after House Democrats passed that $2.2 trillion stimulus bill last week?
We're just learning this morning, Allison, that indeed they did talk today and they plan to talk again tomorrow. That comes after Pelosi on Friday struck a really optimistic tone that maybe, just maybe, they can get something done. Now, the House is out, but that doesn't mean that if a deal was struck that members couldn't be called back to cast a vote. That said, they still have some major sticking points on this, including the money to state and local governments. There's still several $1 million apart. But you see now the president also, for the first time, really inserting himself there now, tweeting about it. You really see a sense that all sides want to get something done. We have not gotten relief to the American public in many, many months, even though the House is coming back, repeatedly lowering the original amount that they were asking for. So you do get a sense that there is some kind of cautious optimism. But again, they do remain far apart on some significant points, Allison.
This could also potentially affect the confirmation hearings for Supreme Court nominee Amy Coney Barrett. They are supposed to start a week from today. As we mentioned, 3 GOP senators testing positive for the virus. 2 of them are on the Judiciary Committee. How could that potentially affect this confirmation timeline?
The Senate Majority Leader Mitch McConnell says it's full steam ahead. However, all of the members, Allison, have potentially, and I say potentially because they were all in a meeting together just last Thursday, where you had known coronavirus positive senators, Mike Lee and Tom Tillis, sitting in that meeting room for an extended period of time. So there's going to be a couple of important variables here. First, what havoc does the coronavirus wreak, not just on the Judiciary Committee, which all of those members now, I know based on my own reporting, are scrambling to get tested, but also what kind of procedural rules can McConnell use to try and thread this needle? Because he can do virtual hearings, which the chairman, Senator Lindsey Graham, has said they're going to do. But when it comes to a vote, right now the standing rules on that committee require that all of those senators vote in person, not that they have proxies. And it's the same issue when a vote would come to the Senate floor. So again, a lot of this depends on how much they can pace this out and just cross their fingers that no more of these committee members, and indeed the entire Senate conference, gets really sick with this. Because once it does get to the floor, again, has to be all of them in person. And we already know of 2 GOP senators who have said no dice. Senators Susan Collins and Lisa Murkowski have said they don't support this. So Senator Mitch McConnell really does not have much room for margin of error here. He cannot afford for this to be impacted by senators actually being out sick. And even though Senator Ron Johnson said he would come in a moon suit to vote, even if he's still sick, that's going to draw some backlash, I would think, from many of the senators. If you see known coronavirus positive senators threatening to come and vote on the floor in person when they are infected with the coronavirus, Allison.
Yeah, it's a scary thought there for sure, Heidi. We hope nobody else gets sick there and that they find a way to figure this out without bringing sick folks to the floor. Heidi Prisbilla, thank you so much.
Thank you.
Hey, everyone, I'm Allison Morris. You're watching NBC News Now. Let's go to NBC News correspondent Simone Boyce. She's got the very latest headlines from NBCnews.com, and there are plenty of them. Simone, how about an update?
Hey, Allison, let's get everybody that update right now, starting with this. White House Press Secretary Kayleigh McEnany and 2 of her deputies have now tested positive for COVID-19, adding to a growing number of Trump administration officials infected with the virus. We're going to have more details on that in just a few minutes, so don't go anywhere. And the CDC updated its guidelines today to say the coronavirus can spread via airborne transmission. The agency has revised its findings on viral spread 3 times within the last month, adding to a lot of confusion that so many Americans are feeling right now. And the U.S. Deputy Secretary of State is calling for an immediate ceasefire between Armenia and Azerbaijan. Both sides have engaged in deadly clashes over the last few weeks along their disputed border. Well, Uber and Lyft plan to spend nearly $100 million to fight an initiative in California that would make the companies reclassify their drivers as employees. Voters in the state will weigh in on the initiative at the polls next month. And the Supreme Court greenlit a class action lawsuit from the world of minor league baseball today. Players from California, Arizona, and Florida sued major league teams back in 2014, arguing they were getting paid less than minimum wage. Well, that'll do it for right now, Allison. I'll see you soon.
All right, Simone, thanks so much. After spending 3 nights at Walter Reed Medical Center, the president says he is leaving the hospital tonight. Here's White House physician Dr. Sean Conley's latest update on the president's condition.
Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care 24/7.
NBC News correspondent Carol Lee joining me now from Walter Reed. Carol, the president will continue his coronavirus treatment at the White House. How do they plan to do that safely?
Well, look, Allison, the president going home, so to speak, back to the White House is not like you and I going home from the hospital into where we would live. This is a place that has a really robust medical facility. As the president's doctor mentioned, he will be monitored 24/7. The difference is that, and part of the reason why they brought the president here was that there's an elevated level of care that the president can get here at Walter Reed Medical Center. Now, the president's doctor said that he met or exceeded all the standards for leaving the Walter Reed today and returning to the White House, but it's not as if he's going to go back to the White House and just go about his business. He will need to be in isolation. They have to find ways for him to conduct the country's business, to recover without coming into contact with so many people as he typically is. So how they're going to set that up is one of the big questions. But we do know in terms of the president's care that he's supposed to get a 4th dose of remdesivir tonight before he leaves Walter Reed around 6:30 p.m., according to him. And then he'll get a 5th one again tomorrow. The president's doctors said that he hasn't had a fever for the past 72 hours. His temperature was 98.1 earlier today, but also leaving some questions unanswered. Specifically, what does the president's lung scan look like? That's been a question that the president's doctor has been asked going on 2 days now and has not provided a clear answer, and it's not exactly understandable why. There were points at which the doctor's briefing where he said that he could only go so far. He was not authorized to share various things. So we still have a number of questions. But as of now, the president is heading back to the White House, which we know from our own reporting, and the president, frankly, showing us with that impromptu drive-by to his supporters, some of whom are out here right now in front of Walter Reed. He's been itching to go home. And so between that and the president's doctors evaluating him, his doctor said that they've decided that that is something that is safe, Allison.
Carol, more of the president's aides tested positive today, including White House Press Secretary Kayleigh McEnany. What else can you tell us about the positive infections among the president's inner circle?
Yeah, what we're learning is just that a number of people who work in the White House, who have been around White House officials, continue to test positive. And it's important to point out that Kayleigh McEnany, part of what she said in her statement today, is that she has tested negative every day since Thursday until she tested positive this morning, Monday. So just because all of these officials come out and say they've tested negative doesn't mean that they're in the clear, obviously, as Kayleigh McEnany's case would indicate. And what she did in between all those days in which she was testing negative is she returned to work at the White House. She was inside the White House working. She was out on the north lawn of the White House. She addressed reporters yesterday, took off her mask. They were outside. The exchange was not long. But again, she was still going to work. And so what we're hearing from inside the White House is that there's a lot of anxiety. A lot of people don't know exactly whether they should be quarantining, who they came into contact with that they need to be concerned about. And with Kayleigh McEnany and two of her aides testing positive today, we're all sort of wondering, where this is going to end, how many more cases of this we're going to see, Allison.
Carol, to that end, you mentioned this, the president's physician not saying when President Trump last tested negative for the coronavirus. How is the White House able to properly contact trace without sharing that specific kind of information? And what kinds of concerns are you hearing about at the White House, beyond the White House, perhaps even to the Capitol, where we know folks are testing positive?
Yeah, the contact tracing is one of the big questions. We heard from the White House that they're following CDC guidelines and that the White House Medical Unit is conducting contact tracing. But then we hear from people privately who say, White House officials who say that they are learning about these positive cases really at the same time that we are, which is when they become public. And so there's a lot of concern about how the contact tracing is getting done. And the reason why it matters of when the president's last negative test is because that's when you would then try to measure at what point was it risky for someone to have been around the president. And we just don't have a clear answer on that. And the way the White House is posturing itself is, and we heard this from the president's doctor today, he said, I don't want to look backwards, I want to look forwards. Well, there's still a lot of questions to ask in terms of what the processes were, what the procedures were, when the president was tested, when his aides were tested over the last week to 10 days.
Carol, I know he is just being released tonight, and so all this information is so fresh. But what else do you know about the president's plans to isolate and then eventually to potentially quarantine? I think a lot of us are thinking 10 days from now. There is a presidential debate that has not yet been canceled, and we're wondering, is he planning to fully resume his normal schedule soon? Do we have any indication there?
I think the indication that we have so far, Allison, is that this is a president who wants to get out and be back to normal as soon as possible. Everything we've seen from the White House since he arrived here on Friday evening has been images of him at work, has been tweets showing that, videos showing that he's up and he's got a suit jacket on. I mean, and part of what we've heard from the president's aides is this message that he's constantly calling people. He's making directives. He had a national security meeting yesterday with a number of his national security officials. And, we're a few weeks out from an election, and this is a president who wants to get back on the campaign trail. So you could probably surmise that he's going to try to push it and get out there and back to normal as soon as he possibly can, just based on what we're seeing here in terms of the pressures and the sort of he's itching to get out of Walter Reed. I think you could also apply that once he gets back to the White House, that he'll be itching to get back on the campaign trail and get back to business as usual.
Yeah, it does not seem like he's intending to spend a whole lot of time relaxing at home, if you will, Carol. Carol Lee, outside of Walter Reed Medical Center, thanks for the update. A whole lot happening in Florida today. It is the last day to register to vote in that state. Joe Biden is also there campaigning in Miami ahead of our NBC News town hall there tonight. And Biden is leading with Florida voters. He's ahead of President Trump by 5 points in the latest New York Times Siena College poll of likely Florida voters. NBC News correspondent Mike Memoli joining me now from Miami. Mike, the biggest news tonight, though, really coming out of Washington, where the president is leaving Walter Reed this evening. Any reaction from the Biden camp?
Well, it's interesting. What we've seen since Friday, when the president, of course, his diagnosis became public, is something of a political ceasefire declared by the Biden campaign. Remember, on Friday, his campaign announced that they were going to take down some of their negative actually all of their negative advertising, which is just a small part of their larger ad campaign that's on the airwaves across the country right now. On Saturday, during a virtual town hall that the former vice president did in Delaware, he also said he's reluctant to attack the president while he's in the hospital. And even just this morning, when the former vice president got on the flight to come down here to Miami, when he was asked about that drive-by moment with the president yesterday that's gotten a lot of attention, he said he didn't want to comment in any way about the president, his health, how it's being treated. He said he was going to leave that to the doctors. Well, that changed just a little bit as the former vice president just wrapped up remarks here behind me a few minutes ago. He's speaking in Little Havana, where he sort of marked the end of that political ceasefire. Let's take a listen to what he had to say.
I was glad to see the president speaking and recording videos over the weekend. Now that he's busy tweeting campaign messages, I would ask him to do this. Listen to the scientists. Support masks. Support a mask mandates nationwide. Require masks in every federal building and facility and interstate travel. Urge every governor and mayor to do the same. We know it saves lives.
So Biden returning to what has been really the core of his campaign message for the last few months, which is a strong critique of how the president has been handling the pandemic nationally. You notice there, while he did call for a national mask mandate, really encouraging the president to refocus his efforts on measures that could prevent the continued spread of this disease, there was no direct reference to the president's care or the confusion we've seen that Carol just laid out of the White House, the mixed messages, really. This is a campaign that has been walking a very tightrope over the last few days, wanting to avoid being seen as politicizing what is a very real potential health crisis on the part of the president of the United States.
Mike, what's the latest from the Biden camp on Joe Biden's health in relation to COVID? I know over the weekend the campaign said it would reveal the results from every test that Joe Biden takes. What else are they saying about transparency when it comes to Biden's health?
Yeah, I mean, Allison, it's the question that I've been getting a lot, that I've been then posing to the campaign over the last few days, is how is the president's diagnosis changing the way the Biden campaign is handling itself on the trail here? And for the most part, it hasn't changed things at all beyond that ceasefire briefly I mentioned, where they took down some of their negative ads. In a lot of ways, it's only led them to double down on things they were doing to ensure the safety of the former vice president, to continue to campaign in a very COVID-conscious way. Now, one thing that they did adjust as well, in August, when the Biden campaign announced that he and Senator Kamala Harris, his vice presidential running mate, would be getting tested regularly, they only said at the time that they planned to make public any positive tests, that they would be transparent if and when either of those two running mates did test positive for the coronavirus. What they announced over the weekend was the fact that they would now reveal to the public any result, obviously positive or negative. And we got the latest one on Sunday night, the Biden campaign announcing that he had been tested again yesterday and that he had tested negative. Biden campaign advisors tell me they will have an announcement about his testing every time he's traveling on the campaign trail. It's the same protocols that I have to mention are also in place for the reporters who travel with them. The protective pool, that small group of reporters that is allowed to travel in the motorcade, not on the same plane as Biden, but on a chase plane right behind him, they all have to be tested for the coronavirus each day in order to be part of that pool the next day. And so this is just a little indication of how they've even further accelerated some of their COVID precautionary measures.
Mike, let's talk more about Biden's campaign stops today, visiting the Little Haiti and Little Havana neighborhoods in Miami, talking to voters about the economy. We saw his Build Back Better signs there. What is his key message for these communities?
Well, this is an important day for Joe Biden to be in Florida. Of course, he's got that town hall with us later tonight. But the Biden campaign has been choosing the locations of his travel, where to deploy him, as well as other surrogates based on the voting calendar. And today is the last day for Floridians to get registered to vote in the general election. So part of what he came here to do was to visit these very important constituency groups that the Biden campaign wants to see both increase their turnout, but also make sure they're persuading that constituency to vote for Joe Biden. So his first stop here was in Little Haiti. He talked about how when he was vice president after the earthquake in Haiti, devastating earthquake there in 2010, he played a role in helping the Obama administration respond to that. He also was very critical of the Trump administration for ending temporary protected status for some of the refugees that came here to South Florida after that earthquake. And then here, in his remarks in Little Havana, he actually responded very forcefully to what has been a strategy by the Trump campaign to try to connect Joe Biden and what they have portrayed as a leftward, even more socialist bent of the Democratic Party to the very real resentment that a lot of South Floridians, a lot of Cuban Americans in this part of the state of Florida have about the Cuban regime, about communism generally. Biden very forcefully denouncing President Maduro in Venezuela. There's another important constituency group here in Florida. And he also tied the President Trump, to his affinity for dictators that he said, obviously a real play for that group here in Florida.
All right, Mike Memoli in Miami, where Joe Biden is tonight as well. Thank you so much.
Thanks, Allison.
And you can catch Joe Biden's town hall hosted by Lester Holt live in Miami tonight at 8 p.m. Eastern on NBC News Now. Biden got a pretty big bump after the debate last week. In a new NBC News Wall Street Journal poll, 53% of registered voters supporting Joe Biden compared to 39% for President Trump. That poll was taken after the chaotic debate last Tuesday, but before President Trump tested positive for the coronavirus. NBC News national political correspondent Steve Kornacki here now to dig into those numbers. Steve, Joe Biden up by 8 in our pre-debate poll, now post-debate up by 14. Where is that support coming from, and what else did we learn from these voters?
Yeah, it's a really interesting result there. The widest lead we've seen Joe Biden have in our poll. As you say, this is immediate aftermath of the debate, seems to be related to that likely. That's what's driving it. If you look inside the numbers, the group that Joe Biden made up the biggest ground with coming out of that debate, senior citizens, voters 65 and older. He came into the debate leading among seniors by 4 points. He came out in our poll ahead by over 20 points. This has been an important group we've been watching for a long time. Seniors, obviously a big group in general, a group that votes at a very high rate. They tend to turn out. Also, for the last 20 years, really, senior citizens have been a Republican group. You know, Donald Trump won the 65-plus vote by 7 points in 2016. Mitt Romney, the Republican nominee, won the seniors by double digits in 2012. So even before the debate, Biden was running better than Democrats have lately among senior citizens. It's one of the reasons why he'd been doing so well in the polling. The debate suggests, at least, that senior citizens in particular seem to have, however you want to cut this, is it a more positive response to Biden? Is it a more negative response to Trump? Is it both sort of in combination with each other? But it looks like what had already been a strength for Biden, improved performance among senior citizens, got stronger coming out of that debate.
Steve Kornacki, don't underestimate the senior citizens for sure. Thanks so much for an update on what's going on there and what our polls are showing just a couple days after the debate.
You got it.
Just 8 justices on the Supreme Court as it starts a new term today. It's first since the death of RBG. And there are some major issues on the docket, things like healthcare, religion, and LGBTQ rights. NBC News Justice correspondent Pete Williams joining us now from Washington. Pete, we have seen 8 justices on the bench before, but remind our viewers, what happens if the court is deadlocked on an issue? How is this resolved?
So in any given case, the case simply goes poof. It's as though it never came to the court at all. The lower court ruling is left standing as though there were never appeals, and you can't cite the Supreme Court's failure to resolve it as any kind of precedent. So it basically means nothing.
Pete, the Supreme Court already busy this morning rejecting an appeal from Kim Davis. She's the Kentucky County Clerk who refused to issue marriage licenses to gay couples. Tell us more about that decision.
Right. That was right after the Supreme Court's decision in 2015 that said states cannot ban same-sex marriage. Several couples went to her, the county clerk, and because Kentucky law said that marriage licenses have to be issued in the name of the county clerk, she said, I can't do that. It violates my religious freedom. They sued. She lost. You may remember that at one point, a court even ordered her to issue the marriage licenses. She refused and was briefly jailed for contempt of court. So the issue is a very narrow one. It's whether she can be sued individually. She said, no, I am immune from lawsuits. I'm a government official. The couples who sued her said, no, there is a rule of immunity, but not for somebody who intentionally violates existing law. And she knew the law of the land was the Supreme Court decision. The lower courts have all gone against her, and today the Supreme Court declined to take up her appeal. Now, it did generate a concurrence, but a kind of a warning, if you will, from Justices Clarence Thomas and Samuel Alito, who said, you know, we've got to address this question of what happens when someone's religious views run up against an anti-discrimination law. They said that the Supreme Court's decision in the gay marriage case, which of course they dissented from, made anyone who opposes same-sex marriage into a bigot, and they said the Supreme Court should fix that.
Pete, November 10th is the big day for Obamacare. 20 million Americans rely on the Affordable Care Act for their health insurance. What could happen in this case if Amy Coney Barrett is confirmed before November 10th?
Well, you know, I think the fairest answer to that question is we don't know. However, Amy Coney Barrett has made comments before that said she did not agree. She thought that Chief Justice John Roberts pushed the law beyond the limits, I think is the way she put it, in the original ruling on Obamacare, when the Supreme Court said it could be upheld as a legitimate use of Congress's taxing power. Because remember, what the law said is you have to buy insurance, and that's the individual mandate, and if you don't buy it, then you pay a penalty on your income tax. Well, this case has come back to the court because in the intervening years, Republicans, when they controlled Congress, said, okay, we'll fix this. We'll just set the income tax penalty at 0. So now you can't say that there's a tax saving from Obamacare because there's no tax. Now that begs the question of whether, with no penalty, whether there is still an individual mandate. That's one question. And Amy Coney Barrett, you know, may well, based on her previous comments, agree that that part of the law is unconstitutional, the individual mandate. I think the real question in this make-or-break case for Obamacare is, okay, if you assume the individual mandate is unconstitutional, what happens to the rest of the law? The red states and the lower court judges have all said it's all one big interconnected web. You can't just pull part of it out and leave the rest of it intact. It's like a house of cards. You take one thing out and the whole thing collapses. And they have said, and the Trump administration has agreed with this, that the entire law has to be struck down. The blue states that are defending it, because the Trump administration is not defending the law, say, no, it can be saved. You can take the individual mandate out and leave the rest of the law intact. And how Amy Coney Barrett would rule on that question, I just have no idea.
We'll have to wait and see. Pete, the Supreme Court opening its new term today. Thank you so much.
You bet.
You're watching NBC News Now. We've got some breaking news.
If they do go back to their jobs, they want to make sure that they are protected.
It's news made for your streaming world. Live weekdays starting at 6 a.m. Eastern.
Firefighters have had more favorable conditions, allowing them to push the flames away from homes, but the wind can change all of this on a dime.
We can continue to expect protests as people continue to call for more answers to what happened and continue to call for that accountability.
starting to feel like a typical general election. Both candidates actually out on the campaign trail making their pitch to voters.
The moment to truly understand who we are and who we say we are is right here at our feet.
You got to get a four-year degree, but a four-year degree is super expensive. We have created a system where the ticket to the middle class is a thing that middle-class families have to stress about and borrow for and patch together.
Why is this happening? With Chris Hayes. Subscribe now.
For breaking news in our changing world, download the NBC News app.
This morning across the country, what the new normal for schools will look like.
Many teachers left making tough choices between the job they love and their family.
What am I going to decide? Take care of my children or have a job?
That's an impossible decision.
You're creating a little community school. This is a moment where we can just develop ourselves and develop our community.
Let's turn it over to students. How do they really feel about returning to school?
What I miss is my teachers.
They are resilient.
Today's headlines can be hard to understand, and a lot of kids have questions, so we started a newscast for them. We hope your family will watch Nightly News Kids Edition.
The person leveling the accusations isn't me, it's John Bolton. I have heard from sources, and you guys have reported, that Dr. Fauci, through Secretary Azar, had been banging the pots and pans very early in the year. I worked on campaigns. If that was a campaign event, it was a crummy one.
Deadline White House is now 2 hours. Weekdays from 4 to 6 on MSNBC.
Protests broke out. The coronavirus pandemic.
The story.
Emergency approval to treat COVID-19 with plasma. Many questions remain about how well it works.
From every angle.
How much of the increased tension was due to the militias that came here?
On the ground.
Deadly western wildfires in California.
Entire communities were also wiped off the map.
And in depth.
One of the big concerns is indoor air quality. What are you doing to address that?
NBC Nightly News with Lester Holt.
The only vice presidential debate of this election now just 2 days away. Vice President Mike Pence and Senator Kamala Harris will take the stage in Salt Lake City Wednesday night. And the stakes couldn't be higher, particularly for Pence. He is the first vice president to debate while the president is known to be sick. NBC News political reporter Monica Alba joining me now. Monica, there are more than a dozen positive COVID cases in this White House cluster. What are the campaigns doing to keep Wednesday's VP debate as safe and as COVID-free as possible?
Well, Allison, it is top of mind for both of them. Developments just in the last couple of minutes, we're learning that Senator Kamala Harris's campaign asked that there be a plexiglass divider between her and Vice President Mike Pence on the debate stage in Salt Lake City on Wednesday. That's something we understand the commission has approved. We saw that in one of the senatorial debates in the last couple of days. So that's something it seems they took an idea from that and applied it here on this far bigger national stage. And for their part, the vice president's office spokeswoman Katie Miller said to us, if the senator wants to essentially put, in her words, a fortress around her, quote, have at it. So that gives you a preview of just a little bit of the changes they're already making. And we understand they're also going to be further apart than at a typical debate. They're going to be about 12 feet of distance between the two of them and the moderator as well. So these safety considerations are really significant heading into this debate that you would always pay attention to. Again, as you mentioned, it's the only one of the cycle between the two. But of course, much higher stakes and so many more people watching given the president's current coronavirus diagnosis, Allison.
Monica, let's talk strategy and prep. Senator Harris first. What do you know about how she's getting ready for this debate, what her strategy is for Wednesday night?
She has been doing a lot of traditional debate prep. Of course, she participated in a lot of those debates during the primary season with many more candidates on the stage. But similar to what she was doing earlier in the year, she's in a team of small group of aides. Interestingly enough, we understand that somebody who was playing the role of Vice President Mike Pence has been one of her former rivals and former mayor of South Bend, Pete Buttigieg, who you see in those photos there, has been actually spotted in Salt Lake City, where we know actually that Kamala Harris has been for the last couple of days. So it seems she's been doing even some last-minute practice rounds with him. And we should point out that the vice president just left Washington a short time ago for Salt Lake City. So both candidates are going to be on the ground more than 48 hours in advance to continue their preparations there. But these are two politicians who really do the more typical kind of prep, at least compared to Donald Trump, who basically spurned that kind of preparation and instead did different kind of sessions, as we know now, with several people in close proximity who then all turned out to be positive for coronavirus after those close quarter sessions. We've learned that the current vice president and that Senator Kamala Harris are really preparing with a lot of briefing books. They've been doing actual mock sessions. And something else we learned actually about Vice President Pence is that he was told, instead of just operating with the team that he had 4 years ago, like former Wisconsin Governor Scott Walker, who was critical and played Tim Kaine 4 years ago for that debate, the White House actually suggested Pam Bondi step in and play the role of Kamala Harris because of their backgrounds as former attorneys general, and of course to have a woman standing in for a woman, since this would be a more unique and new experience for the vice president to be debating that. So we don't know exactly how she was utilized, but we understand she was involved in some way. Pam Bondi, of course, a close ally of the president's, was involved in the impeachment defense team as well, Allison.
Monica, let's talk about Vice President Pence. He's no stranger to this process, debating Senator Tim Kaine in 2016. What can you tell us about how he's preparing differently in 2020 and how he might handle questions about the pandemic, given the president's positive diagnosis last week?
Absolutely. I think that's going to be a major topic of discussion. And really, we'll have to see how the vice president defends the president, who was consistently downplaying the virus for months, as we've seen. And as even Donald Trump admitted to Bob Woodward during those taped interviews that he did on purpose downplay the virus, he conceded to him. So how will the vice president defend that in light of now the fact that the president has himself contracted the virus? The first lady, of course, also sick with coronavirus. And though we understand they both are doing well, that's what both of their teams have said, so well, in fact, that the president is being released from Walter Reed Hospital today. A lot of questions outstanding here about the timeline. And so while the vice president, who is the head of the coronavirus task force, we all know, was absolutely expecting questions on the health crisis, they take on a whole new meaning now with this diagnosis. And he will have to answer for some of the mixed messaging also, not just from the president, but from his own doctors, I imagine. As for Senator Harris, she and Joe Biden have really made the coronavirus crisis a centerpiece of their campaign. Again, before we knew the president had come down with this, we knew that this was going to be a huge focus of her. That she was going to be basically criticizing the administration, again, pointing out that the vice president, as the head of the task force, bears a lot of the responsibility, Democrats would argue, for where we are in the pandemic. But again, it takes on a whole new realm of importance given just what's happening in the last couple of days. And there were a lot of questions about whether the vice president was really going to go to Utah for this while the president was still hospitalized. Now, obviously, we know since he's leaving Walter Reed, that was a decision that was made. And again, he should be landing there later tonight. But there is an open-ended question of what happens in the next few days with the president's condition, Allison.
Monica, you've also spoken with some of the president's allies. What would they like to see from the vice president on Wednesday night? Are there things they're hoping he'll avoid or handle a certain way?
Well, I think the vice president said it best just now on the tarmac when he was leaving. He said the president gave him the green light to go to Utah. So the number one thing is they want to project this sense of normalcy despite all the chaos that's going on in the last couple of days. They want to also say to the American people that the president, in his own words, doesn't want those suffering to be afraid of coronavirus, even though he's just been in the hospital for it. And they also want to really get back on the campaign trail. I spoke to some of the allies of the president's reelection campaign who said they're most eager to see the vice president get back out there with crowds and continue to make a pitch that the president can't do right now because he can't be traveling. So the vice president is actually going to be heading to Arizona on Thursday, Indiana on Friday, and continue from there. Again, because the main candidate himself is sidelined with coronavirus, the vice president is going to be stepping in and doing a lot more travel. And we should point out here, he's going to continue to do events, some of which I've been to and been at and reported on, which don't always have social distancing, which have inconsistent mask usage at best. So continuing to sort of flout some of these health and safety guidelines that the CDC itself has put out, the Trump administration endorses, the campaign has contradicted at times. They're going to keep doing that, and they're going to have members of the First Family also hitting the trail in the next couple of days, Allison, to really do a show of force again while the president himself is sidelined with this virus.
Monica, you know this well. We don't often pay such close attention to the vice presidential debate, but that is certainly changing like many things this year. Thanks for the latest on how they're getting ready for it.
Absolutely.
3 GOP senators have tested positive for COVID-19. Majority Leader Mitch McConnell saying the full Senate won't be back for another 2 weeks, not until October 19th. Republican Senator John Cornyn of Texas telling the Houston Chronicle the president let his guard down in his desire to show that we are coming out of this pandemic, and it's a lesson to all of us to exercise self-discipline. NBC News correspondent Heidi Brisbilla joins me now. Heidi, beside the Senate staying away from Capitol Hill for another 2 weeks, what else is Congress doing to protect its members from COVID-19?
That is the main thing that they're doing, Allison. There is still no uniform contact tracing or testing program on Capitol Hill. And here's the thing. Not only do you have the entire Judiciary Committee potentially exposed in an executive meeting last week where you can see footage of the infected senators who have now shown to be COVID positive, Senators Lee and Tillis, speaking without masks, but you have a potentially separate chain of infection, Allison. We know that those two senators potentially and most likely got their infections at that White House Rose Garden event. But the more troubling diagnosis, according to individuals I speak with on the Hill, is Senator Johnson, because he was not present at that Rose Garden ceremony. So that means that there is a separate line of infection there, whether that took place in the Senate or somewhere at home with Senator Johnson flying back and forth. We don't know, but that is a big concern given the age, the general age of a lot of these senators. And we just don't know yet if we're dealing with a few isolated cases that thankfully were caught early and did not lead to a broader spread, or if we're dealing with something within the next 7 to 10 days that could lead to a number of senators coming down or testing positive with this. We just don't have the information yet because there is no uniform testing and tracing. I spoke earlier with one of our producers who talked to Senator Cornyn's staff, for instance. Cornyn was sitting right next to Senator Lee, who tested positive in that Thursday meeting, and Senator Cornyn's office wouldn't tell us even if he's getting a test. Now, according to CDC guidelines, anyone who knows that they came in touch with someone who tested positive for COVID-19 should be tested and quarantined. And yet this is really catch as catch can. We're not getting any indication that those Judiciary Committee members, or even the people who are closest to the COVID positive members, are being tested, let alone quarantined, Allison.
Heidi, House Speaker Nancy Pelosi spoke to Ayman Mohyeldin on MSNBC today about COVID legislation and how Americans need better access to testing and treatment. Here she is.
You have to wear masks. You have to have sanitation, separation. You have to have contact tracing, and you have to have treatment. And that's what we have to get to everyone in our country. My concern is that with all of the opportunities and the privilege of the President of the United States, it still did not protect him from the virus because he was not following any of the guidelines that I mentioned. And our purpose, and we're trying to, in the coronavirus legislation that we're working on now, to make sure that people of color that are disproportionately affected by this virus get the testing, tracing, treatment that they need in order to fight it.
So, Heidi, what is the latest on COVID legislation talks today?
Nancy Pelosi did speak earlier today, NBC News confirmed, with Secretary Mnuchin, and they plan to speak again tomorrow. So given the history there of just talks being really stalled out, that is a good indication. It's a good indication that the president himself has started to wade into this on Twitter and started to nudge both sides to come to an agreement, Allison. But the two sides remain far apart on some pretty critical sticking points, namely the amount. They are still millions of dollars apart on what they think this package should be comprised of. They're still apart on that contact tracing and testing funds and how they should actually be used. And so, the House is out right now. If the two sides do come to an agreement, they could bring them back for a vote and get this done. But as it stands right now, we still don't have an indication that they're coming together on some of the most important parts, which is the money. One side is going to have to bend, or they're going to each have to come together closer as they've inched closer. We started out with Democrats wanting $2 trillion. Now they're moving, or $3 trillion. Now they're moving back down off of that. So it is possible that this could happen within the week, but it's still, a big gulf there.
Yeah, seems like they still have a ways to go. Heidi, thank you.
Thank you.
Ex-felons in Florida still trying to sign up to vote as time runs out. This is the last day to register in the state. Carrie Sanders joins us now. Carrie, in Florida, felons can't register to vote until they've paid all their court fees, but some groups are trying to register them to vote. How are activists working around that law?
Well, it's really complicated because the federal courts ruled, Allison, that you must complete all terms of your sentence. That means that somebody who has been released from prison and finished their felony time in prison, that they have to complete the service, which includes paying court fees and restitution to victims. But it's a mess and it can't be tracked. Take a look right now. This is up in Leon County, where out right now they're canvassing on this last day of voters to try to get more ex-felons to register. They've been at this for almost a year. They've registered 400 ex-felons, and they say the felons have a problem. They go down to the courthouse and they say, how much do I owe? And the courthouses, especially on the old paper records, can't tell anybody how much they owe. It's a mess. And so they're saying, look, we can register these voters because the courts can't tell them, and the courts don't know. And so it's kind of like a catch-22. This is what one of those activists out there said about registering felons.
Well, that's up to the state to prove, and they can't at this point. They passed an unenforceable law because of their neglect of criminal justice records and statistics.
And each clerk of the courts in every county admits that the records are not easily accessible, not only to an ex-felon who says, how much do I owe, but to the court system and the elections office themselves. So this potentially sets up the possibility that the federal courts have announced that you may not register to vote if you're an ex-felon, but an ex-felon went ahead and registered to vote and votes in this election. Allison?
So, yeah, Carrie, could this be a big issue if this is, in fact, a close election in Florida?
Well, absolutely. I mean, this is an incredibly close election based on the polls in the state of Florida. And I've spoken to some Republicans today because their belief is that most of the ex-felons are likely to register as Democrats. And their fear is that there will be these ex-felons who have not paid all their court fees and all the restitutions, who registered to vote and then vote. And the Republicans look back to the year 2000 in Bush v. Gore. And in the state of Florida, we had this long pause, but the difference in the number of votes that determined Bush's victory over Gore was 537 votes. So, yes, it can be very narrow. And just in the case in Leon County, where they believe they've registered 400 ex-felons, and you're talking about potentially upwards of more than 1 million ex-felons in the state of Florida who have learned in recent weeks that, yes, you can register to vote, but then the federal courts ruled that you cannot register to vote, and the confusion has led to a lot of people registering to vote, leaving, again, that burden on the state. So you can anticipate Republicans, if we have a really narrow margin in the state of Florida, you can anticipate that that will be a big challenge.
Carrie, Mike Bloomberg, LeBron James, two big names who have paid off some of these fines and fees so that convicted felons can vote. Bloomberg's fund specifically targeted more than 32,000 black and brown voters. What kind of an impact have those big donations had?
Well, they're big money for those who've been able to track how much money they owe. So we're talking about in excess of 25,000 ex-felons paying off their fees, their restitutions, and registering to vote. You know, Ashley Moody, who is the Attorney General in the state of Florida, has said that the FBI and the state version of the FBI, the FDLE, should be investigating what former Mayor Mike Bloomberg did with that $16 million donation, because it's her allegation that he is buying votes. Of course, when they give them this money to pay off the restitution, the court fees, and all of that, they're not urging them to register one way or the other. They can register as Republicans, they can register as Democrats, or no party affiliation, or one of the minor parties. But Ashley Moody has suggested, the Attorney General here, suggested that this money is really designed to fund paying for more Democrats to vote. And again, it all goes back to that really narrow race in 2000, 537 votes differentiating between the Republicans over the Democrats.
What a small margin there for sure. Carrie, we'll see what happens on Election Day. Thank you.
Sure.
The 2020 census will keep going till the end of the month. A federal judge saying that a shorter timeline would likely produce inaccurate results. But census workers are still concerned about getting a complete count. They're not allowed to talk to the media. So here's what some of them anonymously told NBC News correspondent Joe Fryer.
I think we're a massive risk for an undercount, and from what I saw and the enumerators that I was able to bump into and talk to when I was on the street, because there was just a lot of us running around at one point, everyone was worried. There wasn't a single person who was confident about it.
Like so many things in 2020, the census is not going according to plan. Had 2020 been a normal year with no coronavirus, the count would have wrapped up July 31st. Since the pandemic hit, that deadline has shifted.
The administration has suddenly just announced that they're not only going to not take that extra time they asked for, they're actually going to wrap up the whole census thing early.
And shifted again.
The 2020 census will continue through October.
It was incredibly disorganized. You know, like it's hard to overstate how disorganized it was. This is easily the most disorganized job I've ever worked in my entire career.
In a statement, 4 former Census Bureau directors said the shortened deadline will result in seriously incomplete enumerations in many areas across our country. And an internal Census Bureau document sent to members of Congress and obtained by NBC News warned the tighter timeline could lead to serious errors. But it's not just the tighter and shifting timeline that concerns the people on the ground.
Children under the age of 5 and men of African descent are among the least counted.
We've reported on undercounts that might occur due to climate events like hurricanes and wildfires. We've also highlighted how the Census Bureau has hired fewer people this year than a decade ago. In addition, census enumerators who work this year tell NBC News that fear in immigrant communities, inadequate training, and technological problems could impact their ability to get a full count.
I had to say, no. You know, I'm not a police officer. I have no authority. I'm not interested in your citizenship. But that didn't stop a lot of people from not answering.
In 2019, the Supreme Court blocked the Trump administration from adding a citizenship question to this year's census. Still, some enumerators told us they would encounter people who were afraid to answer the questions, worried they would be asked about their citizenship.
Anytime someone from the Hispanic community, when I knocked on their door, they would just say, "Oh, I mailed it in." I'm sorry. They were very friendly. They were very polite. All said the same thing. I've already mailed it in. Would finally just say, "Just tell me the total number of people are in your house. I don't want to know names. I don't want to know birth dates. Just tell me how many people, how many souls are living in your house," so that I at least had some kind of data to enter into the phone.
What have you been doing to try and communicate, educate with the immigrant community, and make sure they get counted?
Well, we've actively been working with literally thousands and thousands of local organizations that have become our census partners. The census is safe, it's confidential.
Tim Olson is the Census Bureau's Associate Director for Field Operations.
There's always been a challenge within the immigrant community worried about confidentiality. it's more heightened than it has been in the past.
Several enumerators also told NBC News they felt they did not receive adequate training to navigate their jobs during a pandemic. One of their biggest challenges, troubleshooting problems with the census-issued smartphones used to collect data during their door-to-door visits.
When I was operating it, it felt very much like a prototype. It was buggy. It would disconnect often, sometimes in the middle of an interview.
Because the app was so complicated, and oftentimes it would just, if you were in an area where the coverage, the cell coverage wasn't decent, the connection would just drop and you had no way of, it wouldn't even let you enter the data.
Olson told us there was a glitch in extremely rural areas which was solved.
Not one single minute have those systems gone down or failed.
Overall, he said the technology worked well and insisted there were no system-wide difficulties with 435,000 smartphones out in the field.
We're actually pretty pleased at how successful those instruments and the technology behind them have been.
But even Tim Olson was concerned about how the deadline would affect the count. The Associated Press reported that earlier this year, Olson said in an email to colleagues it was ludicrous to believe a full count could be completed before October 31st.
Come January, they should just do it over, or after the vaccine comes out. And people will be less reticent to answer the door. Just scrap all this possibly crappy information that's been compiled and start over.
NBC News correspondent Joe Fryer joining me now. Joe, the Trump administration fighting the federal judge's ruling. Why do they want to wrap this up sooner?
Well, an attorney for the Trump administration was actually before appellate judges today arguing this needs to end as soon as possible. Why? Well, their main argument is that all that information they've been counting, it needs to be processed and needs to be turned over by the end of the year, December 31st. They say that's a congressionally mandated deadline, and they can't process all that information in just 2 months. Now, the deadline has changed a few times, but over the summer, the Trump administration settled on ending the counting on September 30th. But a federal judge struck that down, said no, keep counting until October 31st. She was worried about an accurate count. Well, then the Commerce Department just set a deadline for October 5th. That's today. Once again, a judge struck that down. So now the Trump administration has appealed. They were before an appellate court today and argued that the census shouldn't be subject to, quote, judicial second guessing. On the flip side, you have some cities and civil rights groups. They're the ones that filed a lawsuit saying the count needs to take longer. They're worried that a shorter count impacts underrepresented communities, including communities of color. There's a lot at stake, including federal funding and congressional seats. This is something that the appellate court plans to deal with very quickly with a ruling soon, and it could then possibly end up before the U.S. Supreme Court. Allison?
Oh, Joe, it seems like this back and forth about the census never ends. Thank you so much for bringing us the latest.
Yep.
You're watching NBC News Now. We've got some breaking news.
If they do go back to their jobs, they want to make sure that they are protected.
It's news made for your streaming world. Live weekdays starting at 6 a.m. Eastern.
Firefighters have had more favorable conditions, allowing them to push the flames away from homes, but the wind can change all of this on a dime.
We can continue to expect protests as people continue to call for more answers to what happened and continue to call for that accountability.
Starting to feel like a typical general election. Both candidates actually out on the campaign trail making their pitch to voters.
The moment to truly understand who we are and who we say we are is right here at our feet.
You got to get a four-year degree, but a four-year degree is super expensive. We have created a system where the ticket to the middle class is a thing that middle-class families have to stress about and borrow for and patch together.
Why is this happening? With Chris Hayes. Subscribe now.
For breaking news in our changing world, download the NBC News app.
This morning across the country, what the new normal for schools will look like.
Many teachers left making tough choices between the job they love and their family.
What am I going to decide? Take care of my children or have a job?
That's an impossible decision.
You're creating a little community school. This is a moment where we can just develop ourselves and develop our community.
Let's turn it over to students. How do they really feel about returning to school?
What I miss is my teachers.
They are resilient.
Today's headlines can be hard to understand, and a lot of kids have questions, so we started a newscast for them. We hope your family will watch Nightly News Kids Edition.
The person leveling the accusations isn't me, it's John Bolton. I have heard from sources, and you guys have reported, that Dr. Fauci, through Secretary Azar, had been banging the pots and pans very early in the year. I worked on campaigns. If that was a campaign event, it was a crummy one.
Deadline White House is now 2 hours. Weekdays from 4 to 6 on MSNBC.
Protests broke out. The coronavirus pandemic.
The story.
Emergency approval to treat COVID-19 with plasma. Many questions remain about how well it works.
From every angle.
How much of the increased tension was due to the militias that came here?
On the ground.
Deadly western wildfires in California.
Entire communities were also wiped off the map.
And in depth.
One of the big concerns is indoor air quality. What are you doing to address that?
NBC Nightly News with Lester Holt.
The president leaving Walter Reed Medical Center tonight, announcing on Twitter that he is being discharged after spending 3 nights there with COVID-19. Trump adding, quote, "Don't be afraid of COVID. Don't let it dominate your life." Here's what the president's medical team said to reporters this afternoon.
Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care.
That 7 to 10 days was a window that you'd be concerned about. I don't think we're there yet. So do you have concerns about potential worsening or reversal? And what are your plans for addressing that if it were to happen?
We're in a bit of uncharted territory when it comes to a patient that received the therapies he has so early in the course. So we're looking to this weekend. If we can get through to Monday with him remaining the same or improving, better yet, then we will all take that final deep sigh relief. But as I said, 24/7 world-class medical care surrounding him down there. We're not going to miss anything that we would have caught up here.
Dr. Richard Besser joins me now. He is the former acting CDC director and current CEO of the Robert Wood Johnson Foundation. Dr. Besser, always great to have you, especially on a big night like this. Not out of the woods yet, we're hearing. Then why out of the hospital? Is this too soon? And what do you want to see the president and his staff doing back at the White House?
Well, clearly the course of COVID can be unpredictable and can last much more than the few days that this illness has been going on. One of the things, Allison, that this highlights to me is really the issue of access to medical care. At the start of this pandemic, there were 28 million people without health insurance, and the type of care that they get when they are infected with something like COVID is markedly different. In this situation, there were a lot of experimental therapies that were used, some of which we don't know whether they work for patients with COVID at this level. But they're the kinds of things that the average person in this country does not have access to.
Even with all of the medical staff and medical assistants that he has access to, very different from the average person, are you concerned about him being released so soon?
Well, I would be concerned if someone was not being monitored closely during this period.
Okay.
What you can see with someone who has a COVID infection is a rapid decline. This is a situation where someone's receiving therapies that no one else will have received, and that in and of itself, with multiple drugs, needs to be paid close attention to. So close monitoring needs to take place. But I'm not privy to why the decision was made to move him from one place to another.
The president has said that he feels better than he did 20 years ago. We mentioned his treatment. He's taking several drugs to fight COVID-19, among them remdesivir, dexamethasone, an experimental treatment from Regeneron, supplemental oxygen. That's not everything, and it is a pretty long list. What can you tell us about this combo of treatments? What should we know about the kinds of things that he is taking?
Well, I think the biggest takeaway from me from this is that he's one individual and is doing well from all the reports we've heard. I don't want people to look at this and take away from it. There's nothing you need to worry about. More than 200,000 people have died from COVID, and there are hundreds and hundreds of thousands of other people who've survived but continue to have long-term symptoms from this. So we really need to take this infection seriously. We need to come together. My hope is that this will be a turning point and people will start to do the things, as Americans that can help protect lives, wearing masks, social distancing, hand washing. As we've talked about the impact of COVID, it hits every community, but not every community equally. And Black Americans, Latino Americans, Native Americans, lower income Americans, have a much worse course of this than those of means.
Great reminders, Dr. Besser. Thank you so much that folks should still be vigilant and still take this virus very seriously. Thanks for being with us tonight.
Thank you, Allison.
Hey everyone, I'm Allison Morris. You are watching NBC News Now. We are waiting for the president to leave Walter Reed Medical Center. We will take you there live when that happens. President Trump reportedly taking a combination of powerful drugs tonight, including the antiviral remdesivir and the steroid dexamethasone. Those drugs typically reserved for COVID patients with severe symptoms. Earlier today, the White House doctor said, though, that the president was not experiencing the potential side effects associated with those drugs.
His mental status, can you talk to about whether he has any neurological symptoms? Does he have any side effects from his medications, any fogginess from the virus?
No, I think you've seen the videos and now the tweets, and you'll see him shortly. He's back. Yeah.
NBC News medical correspondent Dr. John Torres takes a closer look at the drugs the president's taking.
He received his first dose of IV remdesivir. The president received a special antibody therapy. We did initiate dexamethasone therapy.
Since President Trump's admission to Walter Reed Medical Center Friday evening, it's been revealed he's received these treatments to combat the coronavirus: remdesivir, dexamethasone, and an experimental antibody cocktail from the drug maker Regeneron. Here's what we know about the treatments and what it might tell us about the president's condition. Among them include remdesivir, manufactured by Gilead Sciences, and it's been found to lower a patient's stay in the hospital by about 4 days.
And it was a placebo-controlled, randomized trial, which I've been talking about for some time now, which is really the gold standard.
It works by lowering the amount of coronavirus in the body. The NIH recommends remdesivir be prioritized for patients who do require supplemental oxygen, a treatment President Trump has received at least twice since his diagnosis.
We try some supplemental oxygen, see how he'd respond. He was fairly adamant that he didn't need it.
As for patients with mild or moderate cases of COVID-19, the NIH says there's, quote, insufficient data for the panel to recommend either for or against the use of remdesivir. Since President Trump announced remdesivir was cleared by the FDA for emergency coronavirus treatment back in May, its use for hospitalized COVID patients has become standard of care. So while its use in and of itself might not be alarming, it might indicate that his stay at Walter Reed may be for more than just, quote, an abundance of caution, as was originally reported by the White House last Friday. Remdesivir has been approved for temporary use as a COVID-19 treatment in approximately 50 countries worldwide, according to Gilead. But Trump's use of Regeneron's antibody cocktail is far less common. The drug cocktail is meant to provide the immune system with a temporary, immediate boost to help fight off the virus. But it's still in its clinical trials. And while Regeneron recently issued a statement claiming the cocktail reduced viral levels and improved symptoms in non-hospitalized COVID-19 patients, it's yet to be approved by the FDA for emergency use authorizations. But perhaps the most surprising thing we learned from yesterday's press conference is that the president is being treated with dexamethasone.
Say dexamethasone. I had to look it up.
Dexamethasone is a steroid. Its job is to suppress the immune system. And it's standard treatment for patients who are severely ill. But it's not recommended to patients who are not on supplemental oxygen or mechanically ventilated. Steroids in general can have side effects including anxiety, mood changes, and irritability, but at the doses used in COVID-19 treatments, they should not interfere with cognition or overall thinking. We'll be keeping a close eye on the president's treatments as we continue to get these updates.
We are standing by waiting for President Trump to be discharged from Walter Reed Medical Center, the White House, saying he'll depart on Marine One at 6:30 Eastern Time. NBC News political reporter Monica Alba joining me now. Monica, what else do we know about the president's departure? I know we didn't get all that much advance warning and don't have all that much information about this one.
Right, exactly, Allison. The president himself was the one to tease this, arguing yesterday in a video that he was feeling much better and indicating that if his doctors allowed him to depart Walter Reed today, that's exactly what he would be doing. And we did hear earlier today from that group of medical professionals who had evaluated the president and said he had met all of the criteria to be released. So we expect that to happen in the next hour or so. And if yesterday was any indication, the president is eager to get out of this presidential suite within the hospital and get back to the White House. We saw that from his brief motorcade ride outside of the grounds that happened really without any major heads up. He recorded a video where he teased the possibility he was going to greet supporters, and that's exactly what he did. So is it possible that he's going to do another video today and then make quite a show of departing? I think that's something we could expect from what we've seen over the last couple of days. And again, the president on Friday, when he was first taken to Walter Reed on Marine One, he really walked out in a suit, walking of his own volition. I think, again, that's something they're going to want to stress he's able to do right now. But the doctors leaving so many unanswered questions earlier today, though, again, they stress he's ready to be moved back to the White House, where he will continue to receive medical care and be treated there as part of the White House medical office that exists on the campus for him, the First Lady, anyone else to use when there are serious medical situations and illnesses. What we don't know yet, Allison, though, is whether he'll be working out of the Oval Office. Will he just be in the residence? We still want to know and have requests into the White House, but they haven't been able to provide those kind of specific details yet.
Yeah, Monica, so many questions about what the president's return will actually look like and what he'll be doing when he's there. Another big question, doctors still won't say when President Trump last tested negative for the coronavirus. Why can't we get a straight answer on this one? And let's just talk about how important that information is, particularly in terms of contact tracing and trying to figure out who might have been close to the president and potentially exposed to COVID last week.
It's an excellent question, and one we have posed to the White House, to the president's doctors, to the Trump campaign, anybody who might have an answer for this. Because looking back at the timeline, exactly as you say, that would help us piece together who may have been exposed and when. So let's even rewind back to the summer, where the president himself indicated there were times where he was only on average, he said in his words, tested every couple of days, not necessarily every day. Now, the White House right now, because they won't be straight with us or with the American public, we don't know if he was tested every day last week. They won't say when his last negative test was, so we're not sure. Now, something really to consider here, though, is that obviously the president went to Cleveland, Ohio for that first general election debate on Tuesday, which the Cleveland Clinic required both campaigns to commit to testing their candidates and anybody who would be entering that debate hall. When we asked the Trump campaign, did they comply with this requirement, they referred us back to the White House in terms of when his most recent negative test was. And again, we've asked Kayleigh McEnany, the White House press secretary, to fill in those details on the timeline. And she said she wasn't going to discuss with timestamps when the president was tested last week, saying only that he's tested regularly. So is it possible that the president wasn't even tested on Monday or Tuesday or Wednesday? We just don't know. And what's critical here is that he obviously tested positive for the first time Thursday after that Bedminster, New Jersey fundraiser, Allison. And again, we have to remind everybody That was after he had already learned that his very close aide, Hope Hicks, had tested positive. And of course, he and the First Lady had had a lot of close contact with her. So we still don't understand why they waited so long to tell us, because then the president, you'll remember, went on Sean Hannity's show Thursday evening in the 9 p.m. hour and said he was waiting for the results of a test. That's likely because then he took a follow-up test. But again, he had already learned that he was positive from the rapid one. And then later in the evening, of course, he confirmed that both he and the First Lady were positive from those more reliable tests into the morning. And that, since Friday, is how we've gotten the timeline since then pretty nailed down. It's those 48 to 72 hours before his positive diagnosis that we still have a lot of questions about, Allison.
Monica, the president's doctors seem to be pretty much in agreement that it is okay for him to be discharged tonight. The average person would most likely not be allowed to go home this soon. Can we talk a little bit more about what's different about the president's home? Obviously, the White House is very different from where any of us live. Medical staff, medical attention. How are those things potentially a factor in this early release?
Really, it comes down to the patient also. He is the patient in chief. He is the president. So there are many considerations and things that apply to him that may not apply to others. You hit that nail on the head there, Allison. They argue that from the White House, they can continue his treatment. He's on remdesivir, we know. This would be his 5th course, which they're going to administer later, either tomorrow or the next day. They can monitor him from there. They can continue to make these calls. And then what we've also learned from the last couple of days, they can administer things like supplemental oxygen, which we've now learned he was on at the White House on Friday before he was transported to Walter Reed. And again, his physicians there have said, we really can't breathe a sigh of relief, though, until day 7 or 10 after his diagnosis. As we know, with so many coronavirus patients, more than 7 million people infected in this country and 200,000 lives lost, that many people experience ups and downs with this disease. It really is a roller coaster. You can have a couple of good days, then a tough day, then some more good days, and then revert back. So what the White House is saying here is that they're going to continue to monitor the president, but it's very clear here from Donald Trump himself that he's eager to leave the hospital. He wants to be back at the White House. He wants to continue working. And again, with Vice President Mike Pence in Utah for that debate, there was some suggestion that the president really wanted to be back at the White House complex and not hospitalized while that was happening. So I think we're going to expect to hear from him directly a little bit more in the next few days on why he felt it was so important to come back. But again, the doctor's stressing there, they're going to continue treating him and evaluating him just as closely as they would at Walter Reed. Now, they don't have all the imaging machinery and tests that they can do there at the White House, but he could always go back to Walter Reed. That's somewhere he would go regularly for his physical, which we know from the last few years. Is that something that could happen again in the coming week? Absolutely, Allison.
All right, Monica, thank you so much. And as we take a live look here at what appears to be Marine One on the approach, let's bring in NBC News medical contributor Dr. Kavita Patel to talk a little bit more here about the president's condition. Dr. Patel, the president's own physician said today he might not be out of the woods. In your medical opinion, is this a sensible decision?
Hi, Allison. It's certainly something that many of us on the medical side who have taken care of COVID patients are a bit confused about. Certainly, this is not your average patient, as you've already mentioned, but he is still very kind of in the thick of things in terms of taking medications that usually require hospital-level monitoring, as well as this kind of 7 to 10 day window where even I've seen patients who look perfectly fine, look like you might even want to discharge them from the hospital, but then they just completely kind of crash because there's a surge of inflammation that comes from the spiky little proteins, those red proteins on the virus. So it would be very concerning to send someone home. And I would also add to that, President Trump is still highly infectious. We know that early on, even if it's been about 5 days into his disease, that we would still be worried about his potential to infect other people. And that would be another reason to keep him at Walter Reed.
For those of you who are just joining us now, you're taking a live look at Walter Reed Medical Center, where you can sort of see there behind the bushes and behind the fencing, just to the right of that truck, what appears to be Marine One landing right now. Marine One, of course, going to Walter Reed to pick up the president, who is being discharged tonight, and to bring him back to the White House. He was diagnosed with COVID-19 last week. He has been at Walter Reed for just 3 nights now. We have Dr. Kavita Patel with us just to talk about the medical situation that the president may be in right now as he prepares to head home. Dr. Patel, we were talking about the president's physician saying that he is not necessarily out of the woods. When is someone with COVID out of the woods, so to speak, in terms of days? And is that different depending on each particular patient?
Yeah, it's a great question. It is different with each patient. And I think the reason we're all struggling is because we have very incomplete information. But here's what we would need to know. I would want to see kind of a chart trending all of these vital signs that we've been talking about: oxygen, heart rate, blood pressure, temperature. In addition to that, Allison, we know that he is getting a lot of blood tests done. I'd want to see trends in those blood tests that are improving. Viral load decreasing. The number of copies of the virus in his blood would be decreasing, not increasing. We know that standard care would be to measure markers of inflammation in the blood, things called D-dimer, C-reactive protein, lots of things. And we'd want to make sure that those are also either not high or improving. And then finally, we worry that there's been some lung involvement. That's the whole reason, Allison, that they started that drug remdesivir and dexamethasone. We'd be looking at the results of his pulmonary, his lung scans, his x-rays. They're taking cultures of his cough and trying to make sure he doesn't have a pneumonia. We would want to make sure all those things are clear. And then you do what we call in medicine the get up and go test, walking around, making sure that you can do that. We have seen evidence on video that the president can do that, but we would still want to see all of these things together. And honestly, that's what I was hoping to get out of these medical briefings, but we haven't so far.
Yeah, we really haven't gotten a whole lot of information so far, except to hear his physicians say they seem to be confident about his discharge tonight. Just to give folks a sense of what's going on here, you are looking at this image to my right, I suppose it is. Oh, there it is. It's a full screen image. I don't have to work on my right and left. Of Bethesda, Maryland. You're looking at Walter Reed Medical Center. Here is what we know about what is supposed to happen tonight. Marine One has landed. The president is supposed to take Marine One around 6:30 back to the White House after being discharged from the hospital. Here's what a source familiar with the planning is telling NBC News about what we can expect this evening. President Trump is expected to exit Walter Reed out of the main doors. You have been seeing those main doors in several of our live shots. He's going to head into an SUV that will then take him to Marine One. Now, the plans are for him to tape a video inside before leaving. The plans are also for him to make this movement, leaving the hospital, heading home, without talking to pool reporters gathered at the medical center. Now, these are plans, of course, so they could change, but here's the guidance that we have received so far. Additionally, the president is only expected to stay in the residence as opposed to spending any time in the West Wing, according to this source. We've had a lot of questions about where the president will be once he gets home, what he will do once he gets home, but a source saying that he is supposed to be staying only in the residence. Again, this could always change. If we know anything about this president, we know he is unpredictable. So we could see those plans change, but this is what we expect will happen. There is an anticipation that there will be very strict limitations on his interactions with staffers, potentially just Chief of Staff Meadows and perhaps a few others. But everyone is expected to be wearing N95s and taking precautions similar to what you've seen while the president has been working out of Walter Reed. Once home, the president is expected to continue to make appearances through videos on Twitter. We may get an in-person glimpse of him. Again, this what a source familiar with the planning for the president's departure from Walter Reed has been telling NBC News. Of course, this is all subject to change, but we are expecting that the president will exit the main doors at Walter Reed, that he will get into an SUV, which will take him to Marine One, which will bring him home to the White House. The White House saying this should happen around 6:30. As we also know, though, oftentimes those plans take a little bit longer, so it could be some time. We are going to stay with you. We're going to keep this live picture up, let you know what's happening all the way way through, so don't go anywhere. We do have Dr. Kavita Patel here with us. She is an NBC medical contributor who you know well. She has been with us throughout this pandemic. Dr. Patel, one of the things I want to ask you about, as the president goes home in these next couple of days, we have talked about how any COVID patient could take a sudden turn for the worse. That is common. What do you expect that his staff will be watching for? What are things in particular that they will be keeping an eye on in the next 1 day, 2 days, 3 days throughout this week?
Yeah, absolutely. And you'd expect that he's going to have his vital signs closely monitored, of course. But honestly, you would look for any change in behavior. You heard a little bit already about how it potentially at that fundraiser in Bedminster that the president was fatigued. Now, for somebody that might not be abnormal, but we know for this president, it is abnormal. So you would look at a change in behavior, Allison. You would look also potentially for some side effects. You know, we talked about these medications. The medications themselves have some side effects that we would be looking for. The steroids themselves can cause confusion, can cause anxiety. Those are the things you would be looking for, because there might be a need to take him back to a higher level of monitoring if indeed he suffers consequences from the very medications that we're trying to use to help him. And then you, again, look for other signs of inflammation in other parts of the body. I've talked about some of the labs that should already been drawn, but these things, again, rash in the skin, changes in other parts of the organs and the system that you would see on blood work, those would all be trends that I'm 100% confident they are looking at. But that would be enough reason to say, Mr. President, in your best interest, we should go back to a higher level of monitoring. Also keep in mind, Allison, that, you know, we've got trauma centers and other hospitals on standby. So he's got an abundance of resources around him.
Dr. Patel, thank you so much. I know you're going to stay with us. I just want to let folks know who might just be joining us what they're looking at right now. This is, of course, Bethesda, Maryland. You are looking at Walter Reed Medical Center, where we are expecting President Trump to be discharged. The White House saying at 6:30 that he's expected to depart Marine One. But, of course, that could be a sliding timetable. Just to give you a sense of what we expect will happen shortly, we expect the president to exit Walter Reed from the main doors. We have a camera there, so don't worry. When that happens, we will bring that live to you. He is expected to head to an SUV. Those are the doors right there. See, we promised. And then he will get into an SUV and then get on to Marine One. There are plans for the president to tape a video inside before leaving. He is also supposed to exit Walter Reed and make all of these movements without stopping to talk to pool reporters. We call these plans because, of course, we know the president can often change those plans, go a little bit off script. So there is the potential he will talk to reporters, though that is not the guidance that we have been given. I don't know if we can call up the shot that we had before, just so we could show folks where Marine One is. You could sort of see a group of SUVs, and then a Marine One is just parked behind them. It landed just a few minutes ago. And so, of course, we are going to stick with this. We're going to keep showing you live pictures. As soon as the president exits Walter Reed, we'll have that those images live for you. In the meantime, we are talking with Dr. Kavita Patel, an NBC News medical contributor whom you all know well. She is on News Now several times a week, helping us figure out everything that we need to know in dealing with the coronavirus. Dr. Patel, one thing we were talking about just a moment ago is contact tracing. That is a process going on right now, a process that has been challenging because we have not gotten concrete information about when the president last tested negative for the coronavirus. And so people are trying to figure out when they may have been exposed if they came into contact with him last week. And that has been difficult to do. How can they what kind of contact tracing efforts can you possibly make without that information? What kind of challenges does that pose?
Well, it does pose challenges, Allison. However, we've faced harder challenges in trying to do contact tracing. So I would say at a minimum, if you are, and we can trace back because the president's schedule is pretty public. So we know that he announced his diagnosis around Friday at 1 a.m. and had a diagnosis several hours before, not clear exactly when, to your point, but I would say at least 48 hours before that Thursday night, late night diagnosis, and then potentially even longer. And then you would also have to look, Allison, at some of the orbits. You know, we're seeing multiple waves of infections, the president, the first lady, Hope Hicks, but go back to that Supreme Court nomination announcement where we do know that members who attended, Congress members and staff and people who attended in that room as well are positive. So you would have to literally, to do the appropriate tracing, just at least rewind the clock at least 48 hours. And if you were in the vicinity of the president for those prior 48 hours or even longer, then you yourself should, at a minimum, and if you were within 6 feet and more than 15 minutes of contact, but, you know, news alert, Allison, we just are getting notice from the CDC. They've updated their website to say that 6 feet might not be enough because airborne transmission, particularly indoors, can last longer. So I would say that if you were in close contact with the president or any of the other people that have been determined to be positive, that's public, that you yourself should talk to a health professional about getting tested, or at a minimum, you would need to quarantine, which means you don't need to, you know, restrict your movements to one room in the house, but you do need to probably stay at home, or at least if you're around others, keep that safe distance and the masks and the other things we've been talking about. There is concern that I have. You know, I live in the DC area. I do have concerns. This is a super spreader event, meaning one person could have infected many, many more people than you would expect.
Yeah, Dr. Patel, I mean, when we discuss this and you start going back and talking about all the particular events that could be in play here when we talk about the Supreme Court nomination, when you say 48 hours, you know, prior to when we knew about his diagnosis, I mean, we're looking at the debate there, which, of course, was an event that the president traveled to. You think of all the reporters that they've potentially come in contact with, all the folks in Washington, D.C., the folks in Cleveland at the debate. I mean, you can just see the ripple effect and how this could spread out and out and out. So then we have to look at what they can do to contain this going forward. Once the president goes home to the White House, what would you like to see? What are the things that you would be comforted by hearing the White House say, okay, these are the precautions we're taking?
Yeah, Allison, that's my former employer ground, right? So I have a lot of sympathy for those hardworking staffers that are there. I'd like to see at least three things. Number one, you do need to do a close and deep cleaning of the White House facilities. And I don't mean just the West Wing. I mean the executive office building that's right across from it. That's very large. You really want to actually see deep, deep structural cleaning like you would at the level of a hospital, Allison, because we know that there are multiple cases that came from there. Number two, not just limiting restrictions to the president. You mentioned that. That's critical. I would actually strongly kind of consider, could you limit the number of employees that have to come to the complex, period? So limiting the numbers that are deemed essential that really do have to show up for work. And then the third thing is make testing easily available. We know that there's been testing available. We've heard reports of testing available for the president, the vice president, the families, and some of the closest advisors. You want every single person who has been on that grounds or in that vicinity, to your point, to feel comfortable getting tested as often as they need to, and especially if they have symptoms, to stay home. So I would do what any basic employer should be doing, realizing that this is an employer with all scrutiny on him. And I think that's a very good kind of point of view to take at this point.
All right, you've been listening to Dr. Kavita Patel, NBC News medical contributor. As we wait for the president to be discharged from Walter Reed Hospital, just to give you an idea, if you are just joining us, what you're looking at right now, these are images from outside the hospital in Bethesda, Maryland. You can see through that fence there. That is Marine One, which arrived just a few minutes ago. It is set to pick up the president to depart for the White House around 6:30, though we have not seen the president yet, so it could be a bit later than that. We are starting to see an increased police presence on cam here on this live image. So that may indicate that we are getting closer to the big event. As you look at Walter Reed, we are told that the president will be leaving through the main doors, that he'll be getting in an SUV, which will take him to Marine One, which will then transport him to the White House. Let's bring back in NBC News political reporter Monica Alba. She's been here with us talking about what is happening here tonight, which is a president being discharged from the hospital after spending 3 nights being treated for COVID-19. Monica, so many questions about the mood at the White House, the concerns at the White House, the concerns in Washington as the president prepares to head home tonight.
Absolutely, Allison. Just look at the White House and the West Wing that the president is going to be returning to tonight. His own press secretary, Kayleigh McEnany, after days of testing negative for the virus, tested positive this morning. We also learned that 2 of her deputies have tested positive. Another attendee from that Rose Garden event for Judge Amy Coney Barrett last weekend tested positive. So these concentric circles just continue to widen and widen in terms of people who've had contact with the president, who've been at the White House, have tested positive, and that only leads to us to believe what the chief of staff himself has said, there likely will be even more cases. So a lot of questions about why it's necessarily safer or wiser to go back to the White House. And again, we understand he will be working out of the residence more, but of course the First Lady has also been diagnosed with coronavirus, and she seems to have a mild case, tweeting earlier today that she's feeling good and will continue to rest there. But if other people in the orbit continue to test positive, there are a lot of questions about why it's better to be back on the complex. But clearly this is something the president wants and is driving. In fact, he just tweeted a couple of minutes ago that he will be back on the campaign trail, in his words, soon. We don't know what that means. And I'm sure Dr. Patel would say that it is highly unlikely for anybody who's had coronavirus to be traveling as quickly as the president seems to be implying. We don't know when he means, but if that's something he wants to be doing in the coming weeks, his doctors will have to evaluate that. They were asked earlier today, in fact, whether that was going to be possible, and they really said we need to take this one day at a time, and we won't be able to breathe a collective sigh of relief about how the president is doing until Monday, a week from today. But it shows you just the president's eagerness to get back out there, to travel, to try to be present during the final few weeks of this campaign. But the other thing about the White House mood, Allison, I'm so struck. We've asked the White House all weekend long about what they're going to change in light of all of these positive cases. Are they going to implement stricter rules? Will masks be mandatory? And we're told no, that whatever they've been doing, they're just going to continue. We have seen aides wearing masks a little bit more often, certainly, than they were before the president was diagnosed. But again, this same kind of culture persists, and this attitude, though we should point out, many staffers aren't even at work today in the West Wing, from my colleagues who were there today, because they're quarantining and isolating at home since they were exposed to either Hope Hicks or Kayleigh McEnany or these other press aides that tested positive, Allison.
And look, Monica, we'd be remiss if we didn't talk about the X factor here, right? I mean, you can put all the plans in place and all the protocol that you want, but this is a president who very often goes by his own rules. There may be a set of plans, and he may divert and go in a different direction, and I can only imagine how challenging it is going to be for the White House staff to put certain protocol in place if it's not what the president wants to do, because we've seen in the past, if he doesn't want to do something, he's just not going to do it.
You're absolutely right. We have example after example of when the president, if he puts his mind to something and he wants to do something, even upon the advice of his aides and allies to the contrary, he goes ahead and he does it. Now, with this case in particular, I think his doctors have impressed upon him that it is possible for him to really regress in his condition, and it is important to continue these treatments. But you're right. His desire to travel again, or to get back out there, or to be doing any kinds of events at the White House is something that likely will supersede the advice even of his own medical professionals or closest aides. It's something that we saw in the last week, for example, when people close to the president even noticed that he was fatigued or not necessarily himself, and pointed that out to him and had discussions clearly about what that could mean. And he pressed forward, even again after his close aide and confidant, Hope Hicks, wasn't feeling well, to the point where she isolated herself on Air Force One on Wednesday on the way back from a campaign rally. The president still went forward with his schedule and that fundraiser in New Jersey on Thursday. I think if you need any indication or prediction about how he's going to act, you have it right there. But the other thing, Allison, I think that is an X factor here, as you point out, is what we don't know about his medical condition. There was a lot today that the doctors continued not to answer for, such as what is happening with his lung scans. That's something that Dr. Conley was asked asked a lot about the president's vital signs and condition, and he would talk about specifics on some of those things. But then when he was pressed on what was found in any kind of chest x-ray, he cited HIPAA laws, privacy laws, saying he couldn't or didn't want to disclose some of those things and didn't want to discuss some of those things. So I think also if we don't have a complete picture here yet of what the president is dealing with, it's very hard to know what he's going to be able to do physically in the coming days. But the Trump campaign, which I cover in my day job regularly, which is intersected completely with what's happening at the White House here, they're trying to now put on a full show of force with any surrogates who they can put on the trail. And that includes at the top of the list right now, Vice President Mike Pence, who's supposed to be participating in a debate on Wednesday in Utah. He's on his way there now. And then directly after that, he's going to go to Arizona and Indiana to continue to campaign, to bring hundreds of people together, sometimes indoors with limited social distancing and inconsistent mask usage. So that's something else. The campaign is sort of looking at what's happened over the last week and saying, we don't really care about changing our policies and procedures. We're going to keep doing what we've been doing.
And look, Monica, you said the word debate. We have that vice presidential debate on Wednesday. The president also scheduled to debate Joe Biden for a second time in 10 days. I'll be very curious to see in the coming days how the campaign, how the White House handles that, what they say about it. I think we can assume that neither the campaign nor the president will want to say, I don't feel well enough to attend, but we'll have to see how they handle. Obviously, they want to project the image of a healthy, working president as we are now less than 30 days away from the election.
You're absolutely right, Allison. And look at where that second debate falls. Essentially just 2 weeks, right in that time frame of after the president was diagnosed with coronavirus. So there are questions. Medical experts like Dr. Fauci say in some cases people recover after 7 to 10 days, but sometimes it's longer. We've seen cases where people continue to have symptoms for 20 days or longer than that. Those long hauler cases that we've come to learn about with this horrible virus that persist sometimes for months. So a big question will be when he's cleared to travel. But I think something that the Commission on Presidential Debates is also evaluating is, can you have this kind of event in a different way? Can you do it virtually, for example? Is that something that either the Biden or Trump camps would actually entertain and commit to? We just don't know at this point because, again, so much could change between now and then. But yes, the Trump campaign has said for their part they would like the president to participate in the next 2 debates, seeing first how this week goes and knowing that the circumstances around those debates could technically change. But I think you're going to see the president eager to participate in every campaign setting and stage possible between now and November 3rd.
All right. So if you're, Monica, thank you so much. If you are just joining us now, or if you're looking at the clock perhaps and saying it's about, what, 6:34? Yeah, it's 6:34. Where is the president? Let's update you on what we know so far. It is 6:34. You're taking a live look at Bethesda, Maryland. That is Marine One, which landed about 30 minutes ago just outside of Walter Reed Medical Center, where the president was supposed to be discharged at 6:30 tonight. So they are running at least a few minutes behind schedule. What we know is that the president will be exiting the main doors of Walter Reed. There they are. We are still waiting for them to open and for the president to come out. He is expected to get in an SUV that will bring him to Marine One, where he will then depart for the White House. He is not expected to stop to talk to the pool of reporters outside Walter Reed. That is the expectation, however, and those are the plans. But we know the president can potentially go off script, so we'll see what happens. He is supposed to go home, according to sources tonight. He is supposed to be going home, where he will spend his time in the residence. We are expecting him to have very limited contact with staffers, perhaps only the chief of staff, and that anyone who has contact with the president is expected to wear an N95. What we don't know is more details about what his schedule might look like over the coming days, what his plans for the debate may be over the coming days. We know his next presidential debate is scheduled for 10 days. So we're waiting for all of that information. Just to let you know, if you're joining us, we are standing by waiting for President Trump to be discharged from Walter Reed Medical Center. The White House said he would depart on Marine One at 6:30. It's now 6:36, so they are running a bit late. We continue to see doors opening and closing there, but no president just yet, but NBC News is bringing us a special report. Let's go live to that right
this afternoon on Twitter. The commander-in-chief wrote he was feeling really good
and don't be afraid of COVID. This all comes amid security concerns and mounting criticism by some for a ride he took outside the hospital yesterday, and as more staffers from the West Wing, including his press secretary, Kelly McEnany, test positive for coronavirus. The cameras trained on the front door when he arrived at the hospital back on Friday. You may recall he stepped off, was ushered into a limo, and then taken in an entrance out of view of the cameras. But now we're told he'll come out of the front doors. The steps, that entrance may be familiar to viewers who have seen the medical briefings from the staff that has been treating the president. We don't know if he will make remarks. I don't see the microphone stand that we have seen there before. And of course, social distance would be called for in order in this circumstance. So he may just simply get into the armored vehicle, onto the chopper, and then back to the White House. White House correspondent Peter Alexander is at Walter Reed right now. Peter, what can you tell us?
Well, Lester, you just saw the president's photographer exit that front of Walter Reed, which demonstrates that in many ways this is a photo opportunity that the president is planning to embrace as he exits today, an opportunity to try to say to America that he is back, as his own doctor said today, to try to project strength and to try to return to form with the campaign in its waning weeks, now less than a month before Election Day here in the United States. This has been a remarkable scene, and here I think there's Donald Trump.
Mr. President, how many staff are sick? How many of your staff are sick? Thank you very much. Thank you. Do you think you might be a super spreader, Mr. President?
President taking no questions, but certainly a demonstration, a sign of strength, walking by himself, gently tapping the railings as he came down, but walking virtually unassisted as he now goes into that armored SUV, much like the one that took him on the tour yesterday of the neighborhood to greet well-wishers. It'll be a short ride just to the other side of the hospital where Marine One is ready and waiting for him on a helipad. And then if it is anything like a few days ago, it'll be about a 10-minute ride to the White House. The president returning to a White House that's very different. As we have noted, a number of staffers, people connected to his campaign and the Republican Party have tested positive for coronavirus. So he will be certainly confronting that. Doctors not exactly explaining in great detail how he will be isolated, what the circumstances of how he will be staying in the White House will go under these circumstances. Of course, his wife, Melania Trump, also tested positive for COVID-19. At the last report we had, her symptoms were considered mild. She did not make the trip to the hospital on Friday. And as far as we know, she is doing relatively okay. And you can see that motorcade beginning to move just a short distance. There have been a lot of people who have been camped out of the hospital, many supporters, some protesters who have been, creating certainly a lot of attention there over the 3 days the president has been at Walter Reed. They, as we reported a bit earlier, had been moved to the other side of the street, a little bit farther from the helipad. But they will be certainly in a position to watch it leave. They were certainly able to see it make its approach and land within the last half hour. This is obviously a very long shot camera here, so pretty fuzzy picture, but the presidential SUV making its way to the helipad. I believe Peter is still with us. Peter, the president, I think all I heard him say was thank you very much. Did you hear anything else?
No, that's all that I heard, and it wasn't clear whether the president would have any remarks. Really, it was that photo that he wanted. He wanted to demonstrate as he has over the course of the last several days, that he is in form, able to work, and continues with his routine. But what's noticeable is how little we really know about his condition at this time. His doctor refusing to provide any details about those lung scans, which is significant because it would potentially be revelatory about whether he has any COVID-related effects, possibly pneumonia. Even as he heads back to the White House, the president is taking a series of experimental antibody cocktail. He's taking an antiviral drug, remdesivir, also taking dexamethasone. That is a steroid, Lester, as we've been reporting, that is typically only used for severely ill coronavirus patients. So even as the White House says that he really has only had sort of mild symptoms, a mild bout with this, the way they tried to describe it, he is being prescribed drugs that would be used for a much sicker patient right now. To give you a sense of the scene right here, you can see some of those folks behind me. This, Lester, has been a wild scene over the course of today and, frankly, over the course of the last several days. There have been what started with dozens turning into hundreds of Trump supporters arriving here from all around this region for an opportunity to try to cheer on the man that they love, the man that they say deserves 4 more years in office. And then protesters arrived, police arrived as well. It's just really been part of what in many ways has become the reality TV presidency over the course of the last several years in the eyes of many.
Peter, we just want to know, we just saw the president climb his way up the stairs. Yeah, he just climbed up the stairs and is aboard the chopper now. One thing I noted, Peter, there appeared to be no medical staff in sight as the president left. Appeared to be simply aides and Secret Service. The president in his usual business attire, and flashing a thumbs up and a fist as he got into the vehicle. But we didn't see anyone certainly in lab coats or in medical garb.
Yeah, that's right. I didn't see any of those doctors as well, but recognize, even as his own doctor said, when he returns to the White House, he will have some of the best medical care on the planet, elite doctors surrounding him, an array of drugs and other treatments available to him right now. So even as the president earlier today said, don't be afraid of COVID, his experience is very different than that of many average Americans. So many families across this country, that of more than 210,000 Americans who have lost loved ones, will hear those words and feel like the president does not understand their pain or their experience. But all of this is clearly by design for a president who believes that the more he's talking about coronavirus, the more that is the topic at hand, the worse it is for his re-election hopes. His desire is to focus on the future, looking past this virus, even as many people, including his own public health experts, say we still have many difficult months ahead.
As we see the presidential motor pool clearing the helipad, the chopper about to leave, let me bring in Tom Costello. And Tom, you can pick up a little bit on what Peter was talking about, that the curious thing in all this is that I guess we don't have Tom. I'm sorry. I apologize. But of course, what I was going to point out, one of the curious things is the medical regimen, the treatments he's received, some experimental, some considered very aggressive for more serious cases of COVID. And that has left a big question mark over all this. And certainly his treating physician not wanting to go into specifics about what the lung scans look like or some of the other key telltale things that doctors would look at to evaluate COVID-19 patients' condition. We know from our reporting of this disease, it can show one way at one time and then swing violently the other direction with little warning. And again, doctors say they have what they need in the medical facilities of the White House. Dr. John is with us. Dr. John, I'm playing a doctor right there, so to pick up on what I was saying about this idea that the question marks here that make us wonder if the man who just climbed in that chopper is as well as he appeared.
And Lester, a couple days ago I mentioned the word red flag, and by red flag I meant that he was getting medications that they usually reserve for patients who are severely ill. So of the medications he's getting, one of them is remdesivir. That's the one that Peter was talking about. It's an antiviral, so they give it to patients early on. So that makes sense to give patients who are mild or moderately sick at that point, because you're trying to fight it off. You're trying to actually actively fight the virus with that medication. The other one are the antibodies they were giving them, the Regeneron antibody cocktail, the monoclonal antibody cocktails they gave them. because that also gives your immune system a boost. So it's trying to actively fight off the virus at that point. But the third one they gave him, and this is the one that raised some red flags, is the dexamethasone. That's a steroid. And per NIH protocol, that should only be given to patients who are on ventilators or who are on supplemental oxygen in the hospital. And they specifically say it is not recommended for patients that are not on a ventilator, not on supplemental oxygen. But other experts are saying, you know, at some point, sometimes, even if they're not at that stage, but they're severely ill, then we'll give them that dexamethasone anyway. But it's definitely reserved for severely ill, not mild or moderate. So I think what we're seeing here is the medication they're giving them is reserved for patients who are sicker than they're telling us he is. And it's important with the steroid because if the steroid is given early on, when they're not that sick, it actually can make the patient worse. And so they're going to be very careful with that. So I think, again, what you're seeing, what you're hearing, isn't necessarily what's going on behind the scenes, Lester.
All right, Dr. John Torres, as we watch the chopper Marine One make its way toward Washington, let me bring in Hallie Jackson right now. Hallie, as I noted a few minutes ago, he's returning to the White House, but it is not the same place that he left as more COVID cases linked to the White House and Republican Party are popping up. What do we know about the number of cases right now?
Well, we know, Lester, the number is 14. That is the cases linked to the White House or to the campaign. That includes the president and the first lady. And it includes the White House press secretary, Kayleigh McEnany, who today said that she tested positive for the coronavirus. We've learned today, too, that 2 of her deputies have also tested positive. The White House so far has not said how many West Wing staffers have actually tested positive so far. But I have to tell you, Lester, the White House feels different in more ways than one, right? It is fairly empty in there. It is quieter than I can remember seeing it, you know, not on a weekend when the president's out of town, let's say here, on a weekday where there is a lot of news happening, because many staffers are working from home. Some of them who have perhaps not been directed to quarantine are doing that themselves, choosing to stay away from some of their colleagues. Some have come in. I spoke with one White House official here today. He was wearing a mask. I was wearing a mask outside more than 6 feet. But the question was, why did you still show up to work knowing that this is happening here? The argument from the White House is that they are essential workers, basically. They've been deemed essential to the functioning of government, basically. And there is some work that they feel they have to come into the office to be able to do. So we see the helicopter, Lester, on its way here to where I am on the White House. It'll land on the other side of the building from where I'm standing on the south lawn. And then the president will head inside. I am told by a source familiar with the plans, and I emphasize the plans, that the president is expected to isolate in the residence. So that's not the West Wing. Now, that could change. Let's say in a few days, if the president is still feeling good, decides he wants to go to the Oval Office, perhaps that could change. But at this moment, that is the expectation, that the president will be in the residence. As we've been talking about, and as Dr. John referenced a moment ago, the president coming home to the White House is not like me going home to my house in Washington or you going home to your house where you are. It is a very different experience. He will have 24/7 medical care. He has access to a full medical suite. This is fairly advanced. It is not a hospital, right? The White House is simply not a hospital, but it does have a level of care that pretty much any other American does not have access to. The question of how long the president will need to isolate once he gets back here, right? That is another question here. And we got some insight into that from the president's physician today. Now, typically, the CDC guidelines suggest 10 days for a patient from the start of the onset of symptoms. Dr. Conley said we'll be checking, that the physicians will be checking the president's viral load. They need to make sure that he is not carrying a viral load, in English, that he is not contagious. That's kind of the point of this. That could happen maybe a little before those 10 days, maybe a little after. We know that the president is eager not just to get out of Walter Reed, to get out of the hospital, Lester. I spoke with one source tonight who said he is feeling cooped up and he's ready to go. He's also eager to get out, frankly, of this coronavirus bubble that he's in. He is eager to hit the road. He is eager to travel. He tweeted just before we came on the air that he is ready to hit the campaign trail. He just can't do that, though, until he's cleared to be able to travel, Lester, for safety, for responsibility, for a number of reasons. And that is something that Dr. Conley addressed today. He would not commit to a timeline, but he did say, you know, that the proper indications do have to be in place for that. There have been, as we've noted, some credibility questions, though, given that Conley has acknowledged that he painted a rosier picture over the weekend of the president's health. We know that Friday morning his condition was spiking a fever, his oxygen levels dropped. That was not revealed to the public at the time that it happened, Lester. As you look at this shot now of Marine One flying over Bethesda, it's about a 10-minute flight, so the president should be arriving here fairly soon, just about sunset here in Washington, Lester.
All right, Hallie, thanks very much. I want to bring in NBC News medical contributor Dr. Kavita Patel. and talk about what the president's life may look like, even as we march to the election 29 days from now. A patient like that, I assume you're worried about a worsening of condition, but also we just got a glimpse of what it's like for a president to move, just that movement from the hospital to the helicopter, the number of people involved, the number of people that will receive him here. What will his ability be like to interact with others around him?
Yeah, Lester, these are exactly the questions that I think everyone should be asking, and especially the people around the president. As you stated, it's very natural. This is a president who likes to be out there. He gets energy and feedback from a crowd, but it is unusual to have a circumstance where that very crowd is something that he can pose a risk to. So the next several days are critical. Not only will his traditional vital signs, the heart rate, blood pressure, oxygen, all the things we've been talking about be monitored very closely. But Lester, you're also going to look for just changes in affect, meaning does he seem like he's a little different? We've already heard that in Bedminster, he seemed a little lethargic, and so meaning a little more tired, and we're going to be looking for those types of changes in mood or behavior. And then even weeks out, Lester, I see patients who are months out of their COVID-19 diagnosis, totally healthy, even very young, and they have kind of a post-COVID-19 syndrome, various ailments, joints and pains and headaches. So we will need to continue to keep a very close watch over the president, the first lady, any of the people that have been infected, and not make any assumptions. We know this virus is very humbling, and I think that's exactly the attitude we have to take in thinking about the president's course of illness.
All right, we saw Marine One passing by Washington Reagan National Airport, now passing the Washington Monument on its final approach and descent onto the White House South Lawn, where we fully expect to watch the president again walk out under his own power and return to the White House. You saw a second chopper there that usually flies alongside in some kind of a support role. It's now moved aside, and Marine One, designated as Marine One when the president is on board, is now making its approach, and you see it descending onto the south lawn of the White House. As we watch the chopper, we'll get another shot here shortly, but as we watch it pivot around, this means that we will likely not see much of the president because he'll exit from the left side of the chopper. Typically what happens is we've got a pool crew that is going to video the president's stepping off the chopper and into the residence. That will get turned around very quickly and shared with all the networks, so we would expect to see that in just a few brief moments. But we will see the Marine Guard come out. We will likely see the president, at least part of his legs, maybe, as he exits the chopper. So just a little more than 72 hours from when the president departed the White House on a day that it was later acknowledged he had a drop in his blood oxygen level and was showing other COVID-19 symptoms. The president has now returned to the White House, to the residence, where he will continue to convalesce. His doctors held a news briefing today and said they believe that he is medically able, that he's indicated all the things they look for when they decide whether to discharge a patient. We have noted there are some questions about the aggressiveness of the treatment regimen he's received that have set off red flags among some physicians who will follow this very closely. Nonetheless, doctors said they were in agreement about the decision to let him return home and to convalesce and to isolate. And of course, we don't quite know what isolate will mean in the case of the president. Noticing the doors being open right now at the White House residence. We don't know if we're going to see members of his family or Hallie Jackson. I don't know if you're able to watch with me that balcony door that just opened. Do we know if there will be a special greeting of the president there?
You know, we don't know for sure, Lester, but given what we've seen so far with the optics of President Trump wanting to be seen, wanting to show the American public that, yes, he can, walk out on his own, he can appear on his own, I wouldn't be surprised. I picked up, Lester, at the same time as you did on the activity there up on the balcony. I will note, typically, this is not a shot that our viewers often see. We don't normally have this shot up and ready to go because we do have reporters on the other side of Marine One where the president is departing. I'm watching the bottom of the screen there to see if we can get any indication as to when the president will be stepping off the helicopter. Lester, I have to tell you, at a moment like this, these are frankly some of the most scrutinized steps that President Trump has ever taken and possibly will ever take. The shot of him coming down the stairs, tapping that railing, as you noted, you have to imagine that the president was hyper aware that the eyes of the country were on him at that moment. A slip, a grip, any of that was going to be read into, of course, by people across the country. And you have to think he knew that was going to be the case. Here, again, the optics are important. Ever since, Lester, I think back to 72 hours ago when you and I were doing this almost to the hour. I was watching this same helicopter take off the South Lawn here and head to Walter Reed. We're now watching it watching it come back now, 72 hours roughly later. And even from the very beginning of this, Lester, it was important for the White House to show the president walking on his own power, getting into the helicopter on his own power. The president is obviously not answering questions.
Yeah, I think, Hallie, I think we're watching the president now walking up the stairs to the residence. That's not a way he normally goes in.
No.
Again, the walking up the stairs, certainly an image that he would be eager to display, and then he will make his way to those French doors draped in American flags.
We see this shot, Lester, folks might be familiar, around Easter, at the Easter egg roll, when they come out, the president and first lady, and wave to the people who have assembled on the South Lawn. That's just to give some context where this is. People might be thinking, I can barely see the president. He looks so small on the screen. We will have a better shot of this. Again, we are using a very long lens here from far away to be able to bring this shot to you live. There is going to be a better look at the president here, so we'll be able to see sort of how he is, how he's moving. He's spending a decent amount of time out there, Lester. I'm having a little trouble myself seeing if he's still waving or making hand gestures, but he is obviously wanting to, frankly, soak in this moment. I can hear now the rotors getting louder, which makes me think Marine One is about to take off. But you can see his photographer there coming in, it looks like on the left side of the screen, with the American flags flanking him. I'm told, Lester, that as the president is isolating at the White House, we should expect and we can expect to continue to see appearances like we've seen so far as he's been spending time at Walter Reed. He's blasted out every day that he's been there videos on Twitter, for example. He did that drive-by over the weekend. I'm told that the president will want to continue to make these appearances during the perhaps roughly 10 days or 6 days left now that he is in isolation, to be able to send that message to the American people. It looks as though he might be waiting now, Lester, for Marine One to be taking off, and our fabulous crew out here outside the White House trying to zoom in as much as they possibly can. We're going to see the president obscured by Marine One as it lifts off, and the president remains on the balcony. So Marine One will go, Lester, and then when President Trump walks back into the residence, it is a question mark of when we will see him next, as it looks like he perhaps delivers a salute there. He is the figure, of course, in the middle of the screen, flanked by those American flags. So the president will now head inside the residence with a wave to the assembled pool reporters down there. Not sure if he's saying anything, yelling, unclear, but we'll be able to tell the audio once we do get what's called, Lester, tape playback, when those reporters run that video right back into the rack room here at the White House and feed it out to us.
Yeah. And I think it's fair to say that the images we will see a lot, certainly on the news, but probably in other places, because it certainly plays to a narrative that the president seems to have embraced about defeating COVID-19. Keep in mind, 72 hours ago, he was taken by helicopter, a very sick man. He's back now. Doctors saying that's okay, that he's in good enough shape. But nonetheless, we will continue to watch and monitor his condition and what happens now. Again, what does isolation look like? This is a tape from just a few minutes ago. You see the president right side of your screen walking up those stairs. He would normally come and go from the lower door, but comes up and spends several minutes outside the open French doors, the chandelier lit, the American flags, and pausing for what appeared to be a photo opportunity and to certainly salute those who were gathered on the lawn before entering the residence itself. These are, again, live pictures here. This is, again, not the shot you'll be seeing a lot of because the pool camera crew has been up close, being able to take many of these images, and we will see them. They will get turned around for greater distribution very, very quickly. Usually in circumstances like this, you don't see the entire White House press crew, but rather a pool of camera operators and journalists who serve basically on behalf of all news outlets. All right. Hallie Jackson, again, is on the other side of the White House. I don't know.
Lester,
we don't. Is that the president that just came out on the left side?
I'm trying to tell, Lester, but I have to say, I don't know if somebody can run back and look at that video. It looked as though the president may have actually taken off his mask before he walked into the residence. Again, it is hard to tell from the camera angle that we have.
It looks like he's come back out again.
Yep. So, Lester,
it's a little bit hard to discern what we're seeing.
Right. And by the way, we've never seen this before, right? We're walking through this live on the air because this is not something that happens at the White House. It looks as though, Lester, the president has his back to us, I believe. But again, I do think it's worth noting that it appeared he had at some point perhaps removed his mask, which is obviously significant given that the president has an active contagious virus currently, based on the assessment from his doctors. It looks as though there are some staff members, I can see to the left of the screen, up on the Truman balcony there. But this is certainly unexpected for the president to be spending so much time out here. And I'm wondering if our colleagues who are part of the pool, who are much closer to the president, had already gone back inside, or if they are still out there getting the shot, Lester.
Well, if he did remove his mask, it's simply hard to comprehend given what has happened not only to him, but to more than a dozen other people who have tested positive for COVID-19.
Lester, it sounds as though
210,000 Americans have died.
I'm looking at reports from our colleagues in the pool. They're sending emails as well. And it sounds as though he did remove his mask at some point before walking back into the residence, Lester. And so that is certainly notable, as you point out here. I'm being told that the president did, at least from the pool. As we try to get another shot, I can't tell if it's back on now, Lester, or what. As he's
I think many Americans could only shake their heads out of those circumstances. We don't know who the other individuals are that have been appearing in that window. Again, this is video from a few moments ago. It's hard to know. Obviously Secret Service, but hard to know who he's been interacting with there in front of the window.
And I have to say, Lester,
certainly delighted to be home.
Yes, and I just want to quickly note that what we've heard from White House officials and frankly medical staff is that anybody who has interacted with President Trump has had on what they describe as full protective equipment. So that means N95 masks. It means other protective gear as well. That was a question as we were seeing these videos of President Trump and pictures inside Walter Reed. And in those images, he was not wearing a mask. And the question came up, well, how are you capturing those images and what kind of protective equipment are the people around him wearing? It also came up in that drive-by. It looks like maybe, Lester, he might be shooting some kind of a video or taking some sort of photo. That is something that we often see the president do. And I would be dollars to donuts. We end up seeing that on the president's Twitter page, if that's the case, at some point later on tonight. I would note, too, the issue of protective gear came up during the president's drive-by on Sunday when he cruised past supporters with his agents in the front seat there wearing at least some level of protective equipment. Here's the video from the pool.
All right, Hallie, this is the pool video now shot moments ago. We'll let it play it out.
please come back in. Ma'am?
In a moment, it's not unlike his recent trip to a church across the street from the White House during Black Lives Matter protests. The president obviously trying to make a very strong statement of strength here, but removing his mask, albeit maybe no one in front of him, is clearly making a statement, perhaps a symbol of strength, perhaps a symbol of defiance. But a man who was rushed to the hospital in a helicopter just 3 days ago, facing COVID-19, which is a death sentence for a lot of people, taking his mask off and standing and posing for pictures on the balcony of the residence. It's a remarkable sight. Fortunately, our tape loses. Our tape, unfortunately, loses that shot of what happens when he gets back up. Is this a live shot? I think this is still a live shot. You see the president there. He seems to be mingling with individuals. We can't tell who they are from this very, very long lens shot. And people seem to be coming and going. Let me bring in Dr. John Torres. This is hard, Dr. John, to watch that. What symbol does that send?
And unfortunately, I think it sends the symbol that we don't want it to send. If you remember on his video, he said he's learned a lot about COVID because of his illness, and he's got real learning, not necessarily book learning, and that he was going to come out with some information that we could all use. I don't think that's the information we want. That taking off the mask, I think, just gives the wrong message to people. And I think here the point being that there are 4 things we know work. Mask being one of them, social distancing, washing your hands, opening windows to ventilate. He's taking one of those and saying, you know, it's not all that important. And that as somebody who is public health has always been important to them, is a little disturbing. And hopefully he continues to give the message that the mask is important and doesn't do necessarily what he's doing there. And there weren't people around him, granted, like you mentioned, but at the same time, people are going to look at that and say, you know, maybe masks aren't as important as we thought they were just 1 or 2 days ago.
Yeah, and Dr. John, let's talk about the whole mask thing. I mean, right now, I'm standing here on national television, not wearing a mask. Audience can't see, but I can tell you that no one's closer than, 9, 10 feet from me right now in an outdoor setting. I mean, I know the science continues to evolve. President standing on a balcony, you could argue that there's very little risk. But what should we know?
Well, Lester, there's a huge difference here, and one of the big differences is that you did not test positive for COVID-19 4 or 5 days ago. You have not been on a triple drug therapy at Walter Reed Hospital to treat your COVID-19, and you're only 5 or 6 days into your treatment. We know that you're still shedding virus at this point, and so for somebody to take off a mask and shed virus at this point is different than you being out there being completely asymptomatic, most likely not shedding, but at the same time social distancing. And one of the things about the mask, and I want to make sure people understand this because it's a message that we've been trying to get across for months, is the mask does protect you to a little bit, but its main point is to protect other people from you. And in this case, President Trump, who we know has COVID-19 at this point, needs to do what he needs to do to protect everybody from getting that COVID-19, including those around him. And so he had the mask off. Granted, nobody around him, but then he walks into the White House. I didn't see him put his mask back on. He may or may not have. But walking in without a mask into an indoor space where people are around, not necessarily social distancing, that puts the other people at risk, and that sends the wrong message.
Oh, you were looking at momentarily a video from shot within the last several minutes of the president. If you're just joining us, he has returned to the White House. Marine One airlifting the president back to the White House. His doctors held a briefing today and said they were all in agreement that he met all the objectives to be qualify, if you will, to be released for convalescence at home. And keep in mind, as we pointed out, his home is not like our homes. They've got a full working medical facility there. Still, we're not going to be able to forget that 3 days ago, even with that medical equipment, they felt they needed to get him to a hospital, acknowledging later that at least 2 times his blood oxygen level fell into what they considered danger zone levels, below 93%, I believe was the figure. He has also been put on some rather aggressive drug therapies, experimental antibody therapy, as well as some other medical interventions that are normally reserved for those with severe cases of COVID-19. And Dr. John, let me just one more question. What is the end of a COVID-19 sickness look like? I mean, there's obviously a beginning. Is there an end, or is it uneven?
You know, that's a great question, and the answer is it's uneven because everyone's going to be different. We know that the CDC says once you start symptoms, 10 days later, they don't consider you contagious if your symptoms have improved and you're fever-free for 24 hours. But that's only if your symptoms have improved. So we know that there are some people that continually have symptoms. On the average, if you have a mild case, it's a couple of weeks. If you have moderate to severe cases, it can be up to 6 weeks before you fully recover. And then some people recover only to get worse weeks or even a month later, and that is what is one of the things that complicates this whole process of the disease. It's simply a virus that we're learning a lot about. It's a virus that's new to us, and it's a virus that we have to take very seriously for the long haul.
Yeah, well, we certainly hope the president will have a speedy recovery for what he has gone through. Dr. John, thank you. And thank you all for joining us. We're going to return now to your scheduled programming. For some of you, that's NBC Nightly News already in progress. And please join me a bit later on for a town hall live from Miami with presidential candidate Joe Biden at 8 p.m. Eastern, 7 Central. I'm Lester Holt. For all of us at NBC News, thank you for watching and good night.